Okay.
That's why I don't like it on the phone, because the phone rings.
Oh.
Well, good morning and welcome to the virtual hearing for the inquiry into budget estimates 2021-2022 for portfolio committee number 2, health. Before I commence, I'd like to acknowledge the Gadigal people, who are the traditional custodians of the land on which the Parliament sits. I would also like to pay respects to elders past, present and emerging of the Eora Nation, and extend that respect to other Aboriginals viewing this broadcast all around the state. I welcome Minister Hazzard and accompanying officials to the hearing. Today, the committee will examine the proposed expenditure for the portfolio of health. Today's hearing is being conducted as a fully virtual hearing, which enables the work of the committee to continue during COVID-19 pandemic without compromising the health and safety of members, witnesses and staff. As we break new ground with the technology, I would ask for everyone's patience through any technical difficulties that we may encounter this morning. If participants lose their internet connection and are disconnected from the virtual hearing, they are asked to rejoin the hearing by using the same link as provided by the committee secretariat. Before I commence, I'd like to make some brief comments about the procedures for today's hearing. There may be some questions that a witness could only answer if they had more time or with certain documents to hand. In those circumstances, witnesses are advised that they can take a question on notice and provide an answer within 21 days. All witnesses in budget estimates have a right to procedural fairness, according to the procedural fairness resolution adopted by the House in 2018. Today's proceedings are being broadcast live via the Parliament's YouTube channel, and a transcript will be placed on the committee's website once it becomes available. Finally, a few notes on virtual hearing etiquette to minimise disruption and assist our Hansard reporters. Can I ask committee members to clearly identify who questions are directed to, and could I ask everyone to please state their name when they begin speaking? Could everyone please mute their microphones when they're not speaking? Please remember to turn your microphones back on when you're getting ready to speak. If you start speaking whilst muted, please start your question or answer again so it can be reported in the transcript by Hansard. Members or witnesses should avoid speaking over each other so we can all be heard clearly. And also, to assist Hansard, may I remind members and witnesses to speak directly into the microphone and avoid making comments when their head is turned away from it. We now need to proceed to swear in the witnesses for the first panel this morning. Mr. Hazzard, I remind you that you do not need to be sworn, as you've already been sworn an oath of office as a Member of Parliament. So we'll start, if we could please, with Ms. Koff. Could you please state your full name and position, title, and swear either oath or an affirmation, whichever you prefer. The cards with the words are before you. Ms. Koff.
Thank you, Mr. Donnelly. Elizabeth Koff, Secretary for New South Wales Health. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. So help me God.
Thank you very much, Ms. Koff. Ms. Pearce, could you please state your full name, position, title, and swear either an oath or affirmation?
My name is Susan Lee Pearce. I'm Deputy Secretary, Patient Experience and System Performance, New South Wales Health. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you very much. Dr. Lyons, please state your full name, position, title, and swear either an oath or an affirmation. Dr. Lyons, if you're available. We might try and find where Dr. Lyons is. We might proceed to Dr. Chant. Could you please state your full name and position, title, and swear either an oath or affirmation? Hello.
Sorry. Dr. Kerry Gay-Chant, the Deputy Secretary, Population and Public Health and Chief Health Officer. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you very much, Dr. Chant. Do we have Dr. Lyons with us?
Yes, I am, Mr. Donnelly.
Dr. Lyons, yeah, very clearly. Thank you, Dr. Lyons. Could you please state your full name, position, title, and swear either an oath or affirmation?
Nigel Lyons. I am Deputy Secretary, Health System Strategy and Planning, and I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you very much, and thank you all for making yourself available this morning. Now, today's hearing is being conducted between 9:30 a.m. and 11 a.m. And from 11:15 to 12:45, with questions moving between opposition and crossbench members only. If required, at the end, an additional 15 minutes is allocated at the end of the hearing for government members to ask questions if they wish. As there's no provision for witnesses to make an opening statement before the committee commences questioning, we'll begin then with the questions, starting with the opposition. So, the Honourable Walt Secord.
Thank you, Mr. Donnelly. It's Walt Secord speaking. Firstly, on behalf of the opposition, Dr. Chant, I wish to convey our thanks and gratitude for your tireless efforts, and I would also like you to convey to your staff and team, doctors, nurses, paramedics, contact tracers, vaccinators, cleaners, allied health workers, hospital workers, our appreciation in these unusual and difficult times. So this is very real. So again, thank you for your work and your deep commitment and for making yourself available today. I'd like to open questions on the issue of children. Now, on the weekend, it was reported that 204 cases involved children under the age of 9 and 276 cases between the ages of 10 and 19, meaning that on the weekend, there were 480 cases of children under the age of 19. Has New South Wales Health recalibrated its strategy?
Can I start? Thank you, Mr. Secord, for that. Obviously, there are some. Can you hear me, Walt, or not?
Yes, we can, Minister.
Yeah. Obviously, there are some serious issues around children. The Delta variant has shown a propensity to transmit amongst children much more than the previous variants. And so that issue is being considered at the moment by ATAGI, which is the advisory group to the federal government. I'm going to ask Dr. Chant to give you the up-to-date position in relation to that. Dr. Chant.
So certainly, Mr. Secord, our position has had to change with the Delta variant. The Delta variant is much more transmissible with children, and children then go on to introduce it can infect their parents, and the transmission chains can go from parents to children. Unlike our previous experience that's well documented, where children were not significant contributors to spread. So what we have done is we're working closely with the National Centre for Immunisation Research, which has done previous work for us in supporting our policy work around childcare centres. Our position is clear that children, ATAGI is currently considering the evidence around vaccination more globally for children 12 to 15, and I wouldn't want to preempt their findings, but clearly it is clear that vaccinating 12 to 15-year-olds once a target forms that view will be an important control strategy. Currently, internationally, there are trials underway for younger children to be vaccinated. I understand that those trials will due to be reporting towards the end of the year, and if those trials demonstrate the safety and effectiveness of the vaccine, again, we will await the advice of a target, but it may be that we are rolling out vaccine to younger children in 2022. In the meantime, we have put in place recommendations that parents do not take their child to childcare unless it is absolutely necessary to reduce the burden. And we've certainly clearly messaged the risks to children more broadly. And we know that children within a household are invariably impacted. And the best way we can protect children is by making sure all those around them are actually vaccinated, Mr. Secord.
Dr. Chant, when did it become apparent that New South Wales Health and health authorities had to recalibrate or shift their attention to children? When did that become apparent?
Right at the beginning of the, fairly early on, we were aware of the fact that Delta, and in part that's also why we've taken those strong positions around schools not returning at this time and the requirements around the protections in schools. Even in the rural areas, there have been quite significant restrictions on activities commensurate with the risk to mitigate that risk of school-based transmission, even in areas where they were not considered to be a threat.
So in the current environment, would you be advising parents in non-curfew, non-lockdown areas to allow their children to use play equipment?
So again, the issue of play equipment is what our advice would be very much that do not interact or have any interaction with other people with the play equipment. And clearly that will mean that you have to take those actions of not going there at busy times. Clearly, with the duration of the lockdown, we are very conscious that people live in apartments and don't have access to a lot of environments, and so it is a balancing act, but we're being very clear in our messaging about the fact that children, parents and children should not be congregating in any of those areas, Mr. Secord.
What advice would you give to parents? It's very, very hard to get children to follow social distancing rules, and very hard to get a very small child, not to congregate.
Well, I think that parents need to make those decisions about how to keep their children and others safe. I've got to say that most of the transmissions that we've been seeing is occurring within the household unit, and also there have been a number of childcare outbreaks. So our focus has been particularly in relation to childcare and our messaging in relation to that, and also within households. And as I said, we really urge the community to be vaccinated in order to protect children. And I would urge parents to, make sure that, supervise themselves closely, and also don't take the opportunity to interact with other people at the time. Obviously, mask wearing is challenging for children, and we've made a pragmatic cutoff of 12, but clearly parents can choose for younger children as well if they want to put them in masks as well as another protection.
Now, has New South Wales Health found, have playgrounds in New South Wales been sources of transmission? Have you, in fact, had examples of that?
Look, at this stage, it is very hard to be definitive. What I would say, Mr. Secord, is that if parents and children interact closely or use those as more meeting places, then that's more challenging. As I said, I agree with you that we need to make sure the public is aware of the risks, but clearly outdoor is also a lower risk environment as well.
So based on the current situation we are in, how does the return of the school year look? What is the prospect of the school year returning?
Again, Mr. Secord, to some extent, those are matters that are currently being considered. Clearly, we have at the moment, ATAGI is considering the advice in relation to the 12 to 15-year-olds, and currently 16 and over can access the vaccine. And we would anticipate that if there's sufficient vaccine, that can really change the dynamic of risk. So, Mr. Secord, at the moment, we're doing that thinking. It would be premature to flag that until we've had the opportunity to work fully through those considerations, looking at when vaccine availability and uptake.
Dr. Chant, so what is the current advice on vaccination of children under the age of 9?
So currently, ATAGI the vaccines are not licensed for use in that age group in Australia. As I said, there are international studies underway to look at the safety and efficacy of the vaccines in younger children. I understand that those studies will be yielding results towards the end of this year or throughout these next few months. They will be considered by the Australian Technical Advisory Group on Immunisation, and advice to government will be provided. And obviously the companies, based on that information, will also seek to register their products as well. So there's both the TGA registration process, which indicates when the vaccine is due to be approved for a certain group.
Dr. Chant, I'll ask one more question, and then if my colleague Courtney Hughes would like to ask some questions. So has New South Wales Health recalibrated its approach with the recent increase in the number of children under the age of 19 contracting COVID? Have you in fact recalibrated your approach?
New South Wales Health from the beginning has recognised and increasingly recognised the important contribution of younger age groups to transmission. And yes, we have, Mr. Secord, taken that into account in our response. And obviously, that will also be influenced by vaccine availability and the decisions of ATAGI. So there will be multiple factors that will need to be taken into account in creating safe settings, as well as the overall burden of COVID disease in the community and the risk that could be introduced into the school community.
So will New South Wales Health be releasing or making a statement for parents in relation to children so that there's clarity and no confusion?
Mr. Secord, could I understand what point of confusion could I just clarify the nature of that question? Confusion in relation to vaccine advice or confusion in relation to risks?
Well, both in fact, because parents are very concerned, and last year they were told that children were very low risk, and now we discover on the weekend that in fact 480 cases were reported on this weekend alone.
Mr. Secord, I can just confirm that we have been repeatedly in all of our communications for many weeks to months highlighting the issue of children and how Delta has been different to our experience with prior strains of COVID. And we certainly have been messaging around the role of childcare centres and the outbreaks we have been having in childcare centres and the changed advice and the risk profile. I will take that feedback that parents still need better messages and work with our communications team and look for opportunities to strengthen that message. But certainly that has been our firm understanding about Delta.
The Honourable
Dr. Chant, thank you very much for your time today, and to all of the other professionals before us. Can I just start by continuing on this line of questioning? The numbers over the weekend were very concerning, of 480 infections under the age of 19. Is this a new trend? Have we seen, is this a continuing trend, or is this a new trend in terms of the ages of children who have been infected with COVID, who are getting COVID?
So this has been the feature of the population. The population in the impacted areas of Western Sydney and southwestern Sydney has a younger age profile than the rest of Sydney. It also has larger household sizes and often multi-generational household sizes. Clearly the feature with Delta is that once Delta is introduced to a household, it's invariable that everyone gets the Delta strain, and that includes children. So the majority of these infections are occurring, as you're aware, we have had very strong messaging in particularly the affected areas, but also globally about only having children that absolutely need to attend school. And I have reviewed and been provided with that information from the Secretary of Education, and I can confirm that school attendance in these areas, particularly the impacted areas, is incredibly low. And I just want to acknowledge the hard work of parents in both maintaining work, but also maintaining that school environment, particularly for the primary school children. I can't imagine how difficult juggling those is, but the community is, for the data presented to me is, in general, the community is very much taking on board our message of not sending children to school at this time.
Yes, it is quite a juggle, particularly for primary school age students. Can I just ask you then, in terms of, do you have a number of children that are currently under the age of 19 in New South Wales who have COVID?
We certainly could provide that. We collate those statistics, but the feature of this case numbers is the vast majority, over 70, probably the 70% of cases are under 40, so a very young age profile. And as I said, it reflects in part the age profile, but also the fact that within households, transmission with Delta is so effective that invariably it does transmit to the children, and hence our settings of not having face-to-face schooling at this time.
So Dr. Chant, are you seeing this worse health outcomes for children? Are you able to give us a figure on the number of children who are currently in hospital?
Can do that. Some children are in hospital for reasons if family members are unable to care for them, but I would certainly be prepared to take that on notice and give you that information around hospitalisations in children. And I would just like to acknowledge that our Sydney Children's Hospital network is doing a lot of good work at supporting children with COVID in the community.
Yeah, we understand that this is a very complex area of medicine, and certainly pay tribute to those medical professionals. Dr. Chant, then is there any chance that children will go back to school before they are vaccinated, given these current increased risks of the Delta virus?
The issue, we are currently working through all elements of our thinking in that regard, so it would be premature we have not concluded our firm thinking. I think it's pleasing to know that the vaccine, ATAGI is currently considering vaccination for 12 to 15-year-olds, and it's quite pleasing to know that Aboriginal children over 12 are eligible for the vaccine, as well as children that have underlying health conditions, and that access has been made available. So again, we have effective vaccines that work, and so that will be a factor that really influences the safety of school settings, as will be the case burden we have at that time, as well as the general immunisation level in the community. So all of those factors will influence what are the settings we can have in relation to children attending school and different for the different age groups.
So Dr. Chan, you did mention that Aboriginal children and at-risk children are eligible now for the Pfizer vaccine if they're aged 12 to 15. Are you able to tell us how many Aboriginal and how many at-risk children have received that vaccine? Just one dose?
That was just recently made available. Certainly for Aboriginal children, it's been in for a while. We would have to approach the Commonwealth to ascertain that, and I would just have to check about the robustness of the Aboriginal AIR. There are some complexities because we don't know exactly segregating cases by underlying disease versus Aboriginality. So notwithstanding those technical issues, we'll be happy to provide you with whatever appropriate data we can to answer that question.
So I'm told that it's incredibly difficult for at-risk students to, at-risk children to book a vaccination, and that that they aren't actually able to book under the current online booking system. Is that correct?
I would have to defer to my DepSec, as I said.
Courtney, can I just interrupt there? Dr. Chan is the public health, obviously, officer, but the person who's doing the vaccination rollout is the Deputy Secretary Pierce. So she might be better able to answer your question, although it also is challenging simply because the responsibility for Aboriginal people generally, along with disability and aged care, with the federal government. So the line of sight's a little more confused, but let me ask Ms. Pierce to answer your question as best as we can at the present time.
Thank you, Minister. The issue with the 12 to 15-year-olds, as Dr. Chan has mentioned, is recent advice with respect to the vulnerable kids in that age group due to illness or otherwise. So the category is not broadly open at this stage. The advice that was issued from the Commonwealth very strongly recommended that these children in these groups attend a GP wherever possible for their Pfizer vaccination. However, we are taking steps to enable children in that age group that are particularly vulnerable to be able to access state clinics, and obviously with the support of the Children's Hospital Network to enable that to occur and to amend our booking system accordingly.
Okay. Oh, sorry.
That's the opposition's time for the moment. We will return for another 20 minutes, but we now move over to the crossbench. I think the Honourable Cate Faehrmann is speaking first.
Thank you very much, Chair. And I too want to just say my thanks on behalf of the Greens for all the work that Dr. Chan, you and your team have done during this time. I just can't imagine the stress that you all must be under, and I just want to acknowledge that in terms of, very stressful times. I did just want to pick up on the issue of kids and children. What about when you're talking about the vulnerable kids in terms of getting vaccinated? What research or evidence does the department have around the symptoms or effects of catching the Delta variant, particularly on kids?
Dr. Chan, if you can answer that.
So we are monitoring the hospitalisation rate and data and generating that ourselves, because obviously we're in a situation where our population is naive to the Delta variant and hasn't had much COVID. So we are working closely with the National Centre for Immunisation Research to look at whether we're seeing any increased severity in children. I would be happy to provide that data to you on notice. We certainly are seeing increased hospitalisations in other age groups, and that reflects the advice of the TARGI in terms of lowering the age for its recommendations for vaccines. So we'd be happy to provide that to you.
So you're looking at overseas data, though, are you, Dr. Chan, in terms of what's happening like in the US, in the UK, just evidence from around the world?
Yes, we are, and we're working closely with our National Centre for Immunisation Research, which sits very much in our Children's Hospital network. It's a national centre, and they've been doing some work for us in collating the evidence for the impact on children. And clearly, I think the Mr. Secord indicated that we certainly are seeing a lot more transmission and cases in children, and we have seen some younger cases also require admission, younger adults in ICU than we've previously seen as well.
What's the international evidence saying in terms of the symptoms in children, though, the long-term impacts? Because there is evidence coming out of the UK and the US, of course, of quite severe health impacts long-term so far for kids who have caught the Delta variant. That's correct, isn't it, Dr. Chan?
To be fair, I'd prefer to take that on notice, because I think it really is important that we give parents the best possible understanding at this point in time. So I would prefer that I provide that in writing in terms of the evidence review around the impact on children. I think it's very critical that parents get the most factual information I can provide.
And can I also point out, Kate, that you can get that information from the National Centre for Immunisation Research and Surveillance. So it's available through the federal government and the agencies that are obviously responsible for bringing together all the research, because each of the state governments are largely dependent, and territory governments are largely dependent on that national conduit for research from overseas. So that might help you in regard to any particular inquiries that you have as well.
Yeah. I think it is critical in terms of allowing kids back to school, and the fact that so far we don't have the ability to vaccinate people under 18 for this virus, yet the evidence coming in from around the world is in fact when kids, some kids who catch the Delta variant do have serious ongoing symptoms, particularly stuff that I have been reading lately in relation to ongoing heart conditions, Dr. Chan.
Certainly, that we certainly need to be very concerned around COVID in all age groups. In terms of the age groups of 12 to 15, I can't preempt the ATAGI advice, but I think that given the experience around the world and the fact that the vaccines are licensed down to 12 for those with underlying health conditions, I would understand that there will be, ATAGI needs to make that decision. But I suppose what I'm trying to say is I just want to give optimism to parents, particularly for the high school students, that I do understand that it is likely that is more likely to be in the short term. As I said, the studies are being done in relation to the younger children, and those studies will be progressively reporting. And can I just acknowledge that ATAGI looks at that evidence, is connected with the international regulators, is well connected, and will be poring over that information. And if there is a positive recommendation and there's no sort of safety concerns, then I suspect Australia will be well positioned to roll out vaccine promptly. And I think that's what we need to do. I mean, I think we need to achieve as quickly as possible very high immunisation coverage. And I believe also that it does need to be across all age groups, but obviously those safety and effectiveness studies need to be brought to fruition. And we need to be able to assure parents that the regulators have looked at that thoroughly, so that parents can feel safe in doing that. But I'm very optimistic because Australia has one of the highest childhood vaccination coverage rates in the world. Our parents really support vaccination for their children and understand the importance of vaccinating children. So I suppose I would anticipate the 12 to 15s will go quite quickly, and the other younger children will have access to vaccine in the new year.
Thank you, Dr. Chand. Just moving on to another issue now. What percentage of community transmission, particularly in the LGAs of concern, is a result of individuals breaking the public health orders?
It's difficult to define that, Kate, because what we can tell you straight off is that in the LGAs of concern, day after day for the last few weeks, it's been around about 75 to 80% of all cases that we announce each day are in the LGAs of concern. But to define which ones are due to, if you like, breaking the health orders is a much more challenging issue. The simple fact is that we believe most people are complying, but there are particular groups that the local on-the-ground health workers and police advisors are a bit challenging, particularly young people, mostly younger men, who have been moving around amongst the households and possibly sharing COVID with households, and that's been the big focus. That's why there have been some recent decisions to try and restrict the movement. But do you want to add anything else, Dr. Chan?
Yes, I think I can answer that in the fact that the vast majority of people do the right thing. But we do know that there have been, tragically, a number of introductions into communities where people have inadvertent, done the wrong thing. We know that people, the Newcastle introductions were related to people breaching the health orders. We do. I would answer that the fact that the vast majority of the community is doing the right thing. And I'd also like to say that the people of Southwestern Sydney and Western Sydney, one of the challenges is that they are the group that are operating so many of the essential services that keep our city going. They're our childcare workers, they're our disability care workers, they're our aged care workers. They work in our factories, they work in our logistics supply. It's in generally a very mobile population, which has higher mobility than many other parts of Sydney because of the nature of the work and the critical work they undertake.
Yes, and just to be clear, Dr. Chan, I have probably a few seconds remaining, but just to be clear, these essential workers that you're referring to are really following the public health orders, and you're saying that the transmissions really occur in households by essential workers who are following the public health orders in those LGAs of concern.
So there's two different things. There's a small handful and it's really difficult to quantify, of people that have clearly breached the public health orders. We do have powers under the Public Health Act and we to require people and work with police in cases where people wantonly indicate they're not going to comply and are a threat to public health. They're called Section 62 orders. There are a number of people that have breached those and led to introductions in various places, or had parties or other events that have led to clusters of cases. In the main, the remainder of the transmission is driven by households and then by extension workplace introductions. And those workplaces can be anything from food stores, supermarkets, meat processing, through to aged care facilities, disabled homes and childcare centres. That is the pattern of transmission, and hence we are trying to ensure vaccination coverage is very high, particularly in our disability and our aged care workers, childcare workers. So we are trying to break that nexus of transmission by maintaining those very high rates of getting up and achieving high rates of immunisation. And that's probably my single most important public health message, that we need to ensure we've got incredibly high rates of vaccination if we're going to keep these settings safe.
Kate, it's the chair here. The Deputy Chair's not present at the moment, so...
I am present, Greg. Sorry, I am present.
Oh,
Can
thank
you
you,
hear
Emma.
me?
Yep, so it's over to you, Emma. Glad you could join us. You've got till 10:18.
Okay, great. Thank you, Chair. And on behalf of the Animal Justice Party, as everyone else has already said, thank you so much for the work that you're doing. I think it's really important just to recognise that you guys have all got cross-party support for the work that you're doing, so that's fantastic, and thank you so much. I just wanted to ask a few questions about the Moderna vaccine that is due to come in, and just to sort of ask what the rollout of that vaccine will look like, if there's any plans, and what the plans will be, if anybody will be given priority for that vaccine when it comes.
Can I just start by saying, obviously, the Moderna is, each of the vaccines have to be approved by a federal regulatory body, and then, of course, the federal government has to make sure that they procure enough of the vaccines to come into the country. And as that happens, then obviously each state and territory has to respond, as it appears that it has evolved that each state and territory has taken far more responsibility for far greater areas than was originally envisaged. I mean, under the federal federation, obviously aged care, people with disabilities, staff who work with them, Aboriginal people, they are all, in theory, being looked after by the federal government, but what's happened is, of course, the state governments and territory governments have had to step in to help. And at the moment, the clarity around the arrival of Moderna, I'm not sure of. So I'll ask my senior official to my left, that is Ms. Pearce, the Deputy Secretary, whether she has any greater clarity, because she literally anything up to 10 or 12 times a day is talking to federal government representatives about the vaccine availability across all types of vaccines. So Ms. Pearce.
Thanks, Minister. In short, we're waiting for further advice from the Commonwealth with respect to the supply of Moderna. Our initial understanding was that, by and large, that vaccine would be directed toward primary care, and in particular to pharmacists to administer, but we await further advice as to the quantity of that vaccine, as well as to whom it will be distributed by the Commonwealth.
Thank you so much for that. And is there also some research overseas that the Moderna might be suitable for 12 to 15-year-olds? Just sort of going back to that discussion, Dr. Chant.
Yes, that's correct. That is the case. So the two vaccines we would be looking at is Moderna and Pfizer, and noting the Minister's comments that things have to be looked at by both the TARGI and TGA in terms of recommendations for vaccine.
In other words, the Therapeutic Goods Administration has to approve it, even if it's been approved. I mean, going back to that question that was asked earlier about 12-year-olds and so on, the United States has been vaccinating 12-year-olds for months, many months. But here the TGA has yet to finalise that, except in particular categories at the moment, but it's likely to happen, I think, isn't it, Dr. Chair?
Yeah, I mean, it's likely that, as I indicated, that we will be able to vaccinate 12-year-olds, but ATARGI is finally looking at that and providing advice to the Commonwealth Government in relation to that. But I am optimistic, given the fact that the vaccines have been approved and rolled out by other regulators, and clearly the approval is down to 12.
And both the Pfizer and the Moderna, correct me if I'm wrong, Dr. Chant, but both of them are messenger RNA vaccines, so there's some, yeah, so that hopefully will be appropriately approved shortly. But sorry, next question.
That's all right. And when the Pfizer and the Moderna are being rolled out for 12 to 15-year-olds, is the plan to, turn schools into vaccination hubs to try to get children of that age vaccinated?
Not yet. But that's because, as I said earlier, the federal government has to work out how they're going to do it. Remember, when the Pfizer first arrived, there were some limits on that aspect because of the fact that it had to be maintained at -70 to -80, and there were insufficient freezers anywhere in Australia to be able to roll it out. But as the ATARGI advice changed on that, and it became possible to keep it for up to, I think it's 31 days, they were able to change their mode of rollout. So GPs were able to take the Pfizer to some degree, as well as the state hubs where we obviously set up the mass vaccination hubs with the large freezers. So at this point, there's no clarity. I would think, and I'll ask Dr. Chan for her comment, but I think the great hope there is that it does, I would think it should go out eventually through schools, because you're more likely to get, I mean, taking, what is it, it's about 20 years ago that we had Gardasil when it first came out, obviously first for girls with human papillomavirus. That's had a fantastic result in terms of getting the bulk of young people vaccinated. Later it became obviously boys as well. And when you compare the rollout in the United States, they've only managed to get around about 25–30% of their kids vaccinated against human papillomavirus in that jurisdiction because of a lack of a national school program. So I think hopefully the federal government will make that decision, but it's a bit off. But anyway, look, I better ask the experts. Dr. Chant, what's your thoughts?
Look, this is really also within Ms. Pearce's remit, but I think the reality will be we will want to get in as many vaccines into arms as, I mean, we're on a trajectory where New South Wales wants to vaccinate as many eligible people as we can, and that the only constraint is, vaccine supply and obviously workforce availability. But clearly we do know that school-based vaccination does yield very high rates of coverage. On average, we get somewhere in the order of 70 to 80% vaccine uptake in school settings. But it will have to be an operational trade-off between what is the best and quickest way to get our susceptible populations vaccinated, and that would be a matter for Ms. Pearce to consider operationally with the Commonwealth.
Sorry, I think it would be more like the national government, because they'll make those recommendations, and then the state governments will be obviously asked to be the operational side, but they'll make the decision through a targeting.
Thank you. Thanks for that. There's also been a little bit of confusion about whether women under 40 with endometriosis are eligible for Pfizer. And I've heard some women were able to get Pfizer as part of phase 1B because it's considered a chronic inflammatory condition, while other women with endometriosis in that age group have been refused. Are you able to provide any advice or clarity for endometriosis or adenomyosis and for women in that age group?
Yeah, I'll ask Dr. Chant for her views on that.
Look, I think the issue becomes mute at the moment because, as I understand, the Commonwealth Government announced opening up the vaccination age range. So I think it's more important to look at who's eligible with the current age range. I would just have to correct myself, and I'm looking at Ms. Pearce, but I understand they made an announcement about opening up the age range.
Might have to take that one on notice, because there's been some evolving advice around, pregnancy, people who want to get pregnant, breastfeeding, and of course endometriosis and some other particular aspects. So how about we take that one on notice and we'll get an answer for you the best we can. And I'll ask Dr. Chan to provide that the next couple of weeks to you. Okay.
Great. Thank you so much for that.
Thank you, Emma, and sorry for not acknowledging you earlier. I wasn't aware that you joined. So
that's fine, Chair.
Apologise for that. Could we move now back across to the opposition?
Thanks very much, Chair. Dr. Chant, given the increased risks of infection in children, particularly that we've been discussing this morning, do you believe that the Doherty Institute target should be revised to include children in those vaccination targets?
Look, these are a matter for National Cabinet, but my understanding is that there is work being done to look at that. And clearly, as I've expressed, I strongly support the vaccination of children. I'm confident that we can vaccinate our 12 to high school students. As I said, the timing for our other students will depend on the finalisation of those safety and effectiveness studies.
You mentioned the National Centre for Immunisation Research. Is there a specific project that they are working on for you at the moment?
They are supporting us in a few pieces of work. They're looking at vaccine effectiveness data. They also provide advice on our childcare advice. So we're conducting a range. We've worked closely with the National Centre to inform our policy thinking in relation to these matters.
Yeah,
schools.
Sorry, I understand they did that specific piece of work for the New South Wales government around infections in schools last year. Are they looking at a similar thing like that now?
That's correct. They're continuing to look at the experience in both schools and childcare centres, and that's the purpose of that, is really to characterise the information and incorporate that in any learnings or safety protocols we put in place in schools.
Okay, and when are you expecting that to come back to you?
Look, that's an ongoing piece of work, and obviously one of the useful issues around that close collaborative relationship is they also synthesise and advise us on new information emerging across internationally, but also when we have locally generated data, they're very quick at highlighting any policy or practice changes that would be commensurate with that. I mean, at the moment, I think you've seen some of that experience reflected in our advice. We've clearly required that childcare workers get vaccinated. So we have incorporated the knowledge that children can transmit, but also are susceptible into our thinking in terms of some of the policy settings we've set, in including our guidance around attendance at childcare.
So you mentioned earlier that there were overseas trials for younger children, that 5 to 9 year old cohort that are due back later this year. Is it realistic to think that we'll have to wait for those before those younger children can return to school?
Look, the best advice I have is that ATAGI wants to see that that information and those studies, and you can imagine it is critical that we can assure parents of the safetiness and effectiveness of vaccines. So my understanding, that would be my best guess at this point in time. Obviously, if some of those studies report sooner, I can just stress that our representative groups are looking at the data as soon as it comes to hand. You know, there is a sense of urgency across all of the specialists, you know, ATAGI and others, to continually review the evidence. And I'm confident that they will look at any new emerging information promptly and provide advice to government. But it is important it does go through those processes.
Oh, absolutely. You know, homeschooling is incredibly difficult, but parents are terrified about this new variant and the way that it will impact their children. So it's only appropriate. They are looking for guidance, though. They are looking for a sense of if the children will go back to school this year. It sounds as though that's increasingly unlikely, particularly for younger children who might not have access to those vaccinations until next year.
Look, I think it is important to understand that there are a number of factors that feed into risk, and it is around the case numbers of the community as well as any inherent risk in the children. So there are a number of factors, and it's too premature to really comment at all, just to know that we are very conscious of the impact on families, our early childhood and education colleagues highlight those issues. So we clearly are considering that now, but as you imagine, it is best that we do that in a thoughtful and considered way, so that we can provide the best advice drawing on that expertise that we have with both the National Centre, the experience we've gathered, and the international experience to inform the correct approach.
Courtney, can I strongly also say this, that Dr. Chant does an amazing job, but she is but one person in the health team. And if we're looking purely at the COVID issue, which obviously is significant, then obviously there would be one piece of advice, but there has to be also other pieces of advice that the government listens to. So there are other members of the health team, who would be talking about, for example, the mental health issues, the cognitive development issues of the children, and weighing up a whole lot of different factors in making those decisions at the end of the day. So it's not really as simple as it seems. Dr. Chan just doesn't say, this is it, and that's what's going to happen. She gives her input, and then there's other health team people talking about it, along with a lot of others, actually educational people and so on. So in the end, it's a collaborative, every decision really is a collaborative decision that filters out from a number of different expert medical and psychological and mental health and other aspects. So yeah, there's no clarity at this point on that issue because of those reasons. They all need to be weighed up.
Yeah, and parents are looking for more information and more clarity. I understand these are really complex problems, but we're just trying to get some insight and some assistance for parents. So can I just move on? Ms. Pearce, I just wanted to come back with one further follow-up question to you. You said that children with special needs who are now eligible for the Pfizer vaccine should go to their GP, but what happens if their GP doesn't offer the vaccination?
Ms. Pearce, I was like, that's not exactly what I said. What I said was, in the first instance, the Commonwealth advice was recommending that children go to a GP, noting that these children presumably have a close relationship with their GP if they have chronic health conditions, etc. Similarly, however, I did note that the Children's Hospital Network also has a close relationship with many children with chronic disease and health-related issues. Consequently, we will be providing access for children in that age group in our clinics. We're just amending our booking system to enable that. In the meantime, we have a manual process because obviously there are different consent requirements and so on for children as opposed to adults who can go through the usual booking system.
Okay, so they can expect that they'll be able to receive that through the Children's Hospital Network or the like?
Amongst others, yes.
Okay, thanks very much, Ms. Pearce. Can I go back to Dr. Chant? Can you confirm how many hospitals have been confirmed as COVID exposure sites or have had outbreaks?
Look, I think that's a matter that we would have to take on notice. That I haven't got that data before me, but it is something that we could provide to you in due course.
Do you think it would be possible, I know we've done this in the past, to report back? I understand you need to leave at 11, but perhaps we could get someone else to report back on that later in the hearing?
Look, I think that probably would be impossible.
You're pushing it, Courtney. You're pushing it today because everybody's flat out the whole health team, but we'll get the details for you. If it had been last year, we could have told you probably off the top of our head because it wasn't as bad, but now because of the Delta variant, quite a few hospitals have had, as you would be aware, Nepean, St George, Liverpool, Westmead, they've all, quite a few have had obviously issues, so we'll need to come back to you. That means going out to update the information from the 15 different local health districts as well, so it's quite a big task, and if you don't mind, because the health team is working under massive pressure at the moment, please just understand we don't want to, not hiding it, just a case of making sure the team isn't exhausted, because they already are, but we'll get the information for you as soon as possible.
Okay, and perhaps you can tell us how many staff and patients have been infected. If you are going to go out and seek that information, if you could just give us a breakdown then of how many staff and patients have been infected at each hospital.
It would have to be a point in time because it's just...
Yeah, that's fine, at today.
Constantly changing.
I understand that. I think my colleague, I'll pass to my colleague.
Can I say, Courtney, the reason why it's so challenging, I was in a meeting, I think last week, with all the private health and public health teams talking about introducing mandatory vaccinations. And it was highlighted by one of the private health groups there that operates nationally, that in Victoria last year, during their challenges, they had more than 10,000 health staff taken offline because of being either close contacts, casual contacts, or actually getting COVID. So what you're asking for is a huge task, which is going to take a lot of time. So I'm just saying it might take us a little time to get it for you. We'll get it.
I understand that. I appreciate that. Oh, sorry. I just have one final question for Dr. Chant. Are you aware of transmission at outdoor sites, including tennis courts? Are there any specific examples of that?
So look, if the tennis people are playing at different ends of the court, it's not going to transmit. But I think what we understand is when people get together, they actually don't stay socially distanced for all aspects. They engage in conversation, their mask may be dislodged. So we are saying that with Delta, it is more transmissible. You have to be cautious everywhere. And if you are exercising, you really do need to be, keeping your mask appropriately over your nose and mouth, and also making sure that you are distant, you keep that distance. So it's often the social things that are coming, and it's hard to tease out those various issues. But this is the time where we do not want those sort of social interactions, particularly with people outside your household, as a principle.
I understand that. But we've got a situation, this is more a question for you probably, Minister, that tennis courts across Western and Southwestern Sydney are closing, golf courses are open, and in the eastern suburbs, go-karting is allowed. I think this, can you just explain why it is that we would be closing tennis courts but yet allowing go-karting in the eastern suburbs?
Look, generally exercise has been allowed, and I think the issue really is, Courtney, that in southwestern and western Sydney at the moment, and no one wants it to continue for very long, that 80% of all cases that we're getting are in those areas. So there have been some additional restrictions. I wasn't part of that, but the health team, obviously working with the police, have made decisions. It's often about, as Dr. Chan just explained, not the actual action if everybody just stood at either end of a court, but rather the fact that coming together to play the game can be a challenge. And I think that's the real issue. And I must say I'm extremely sympathetic with the view you're taking. I share your view, in fact, to the extent that I think it's extremely unfortunate that we're now in a situation where we have people who are not being able to do what they'd like to do. I'm hoping that we get through this as quickly as possible. We really do need the community just to stick with us on the journey for a little while, and hopefully bring those numbers down to stop people being exposed to really very severe illness and death. That's what's occurring, particularly in southwest and western Sydney. It's a very sad and horrible situation at the moment.
Thank you, Minister. For the benefit of Hansard, it's Walt Secord speaking. Dr. Chant, earlier you mentioned that you and federal government were looking at overseas experience. I'd like to turn to vaccination rates. So the figure of 70 and 80 have been set as benchmarks for discussion. How does the vaccination of children play into those benchmarks? I'll give you an example. Yesterday, it was reported that 78% of people over the age of 12 were vaccinated in Israel. However, if you put children into that modeling, it drops to 58% of the population are fully vaccinated in Israel if you put children into the cohort. So how does that play out in New South Wales and Australia? So will that 70 and 80 be pushed out further away from us?
So the reality, Mr. Secord, is these are matters that are being looked at actively. And as I understand, additional work is being done with the new experience with Delta to update modellings for National Cabinet. In broad, can I just express my view in broad terms that I think I've been very clear here that we will have access to vaccines for the 12 to 15-year-olds. I'm not trying to preempt the ATAGI advice, and we will clearly follow that. But I think given that we have been, ATAGI has been comfortable with that children with underlying health conditions and that children that are Aboriginal children have been vaccinated, that the safety and efficacy of the vaccine is clear. So I think that that's an issue. As I've indicated, the timing for the vaccination of younger children will be next year. It is also important to factor in. Yeah.
Sorry, Dr. Chant, I think you misunderstood my question. My question was about the 70 and 80% figures of the community. So once children over the age of 12 were introduced into the modeling, it dropped down to from 78% to 58% of the community. So I want to know, how does that impact on the 70 and 80% in New South Wales and Australia once you put in children over the age of 12?
So, well, can I just clarify? Are you saying if you include the kids as part of the cohort, does it still mean 70 or 80% including the kids, or does it change the percentage? Is that what you're saying?
Yeah, I'm trying to get clarity. So when Israel was claiming 78% of the community over the age of 12 were vaccinated, once they included all children, it dropped down to 58% of the population. So I just want to seek clarity. What figures will we be using in New South Wales and Australia, and how will the Delta affecting children impact on our 70 and 80% that the government federally and at the state level have been pointing to the figure that we have to achieve?
I'll ask Dr. Chan, she may not have that information yet.
So, Mr. Secord, that is a piece that is a work in progress, and it would be premature to not allow that work to come to conclusion federally. But I can't stress, I think it is really important that we do actively convey to the community that it is likely that we will have vaccination of 12 to 15-year-olds in the near future. I cannot say that about the younger children because of the timing of the studies, but I think it is important that the community is given that very clear message that vaccination of the 12 to 15-year-olds is likely to be an option in the relative near future.
But I think what Mr. Secord's asking, correct me if I'm wrong, is if it becomes 12-year-olds, is it then going to be 70 to 80% of all kids 12 and over and adults? Is that what we're likely to see?
Population denominator.
But this is a matter for, that work is being done, Mr. Secord, and it would be inappropriate. I wouldn't want to add to any confusion in the community's narrative until that work has been done to look at what is the optimum coverage and what age group it's defined.
Now, Dr. Chant, back to earlier concerns about parents and small children in childcare and children in primary school. Now, you said earlier, and we all accept, that Delta spreads very quickly in closed quarters. So are there any preparations for or advice being prepared for childcare centres on ventilation? And we are on the cusp of a particularly warm period or a hot summer. What will be the advice on air conditioning and ventilation involving schools and I guess the general community, because I think there'll be a real concern about it spreading. So what would be the advice involving health?
Oh, look, I think this is a really good point, Mr. Secord. Clearly our advice with schools, we've done extensive work about giving guidance about minimising risk by choosing outdoor environments, making sure that places are well ventilated, keeping windows open, ensuring minimising the number of people in certain areas. So ventilation's key. I think the summer will certainly bring an opportunity where we would be wanting to use those outdoor environments in childcare and encourage more outdoor play, obviously balancing that against other, heat stroke and sun exposure and other issues. So clearly that is critically important, as is the vaccination of the parents and the teachers, the childcare workers themselves, because if the parents are the most common way that a child will get exposed is usually from the parents around them. And so if we have those high rates of coverage in our parents, grandparents and people connected to children, that will also provide a buffer against the child becoming infected. So we will be working on, I'm picking up from this that there's a lot of need for additional guidance and discussion, and we may well reach out to the National Centre to look at perhaps some additional fact sheets and information in the light of the, genuine concerns you raised, but that parents want to have some of this information better documented for them. Okay.
Thank you, Dr. Chant, and I've just been advised my time has expired.
Greg, you're on mute.
Yes, thank you, Hon Walt Secord. We now move back to the crossbench. Okay.
Okay, sorry. Yes, thank you for saying it was me. So let's go back to.
I apologise.
I just wanted to. That's okay. That's okay. Let's go back to. I think, Walt Secord just asked some questions in relation to ventilation. Dr. Chant, you said that basically that schools and school buildings are being advised to keep their windows open. I think you suggested. So Why isn't New South Wales Health providing clearer guidance that COVID-19 is airborne as well as being spread by droplets?
I think we have been very clear in that communication. Would be happy to reflect on how we can strengthen that, but clearly that is our understanding, and it is important that the community recognises that. I think we have been messaging very clearly that if you're visiting elderly people, visit on the veranda and sit outside, maintain that social distancing, keep your masks on. So if that has not been conveyed adequately, I'm concerned, and we will do all our, we'll look at all of our material and see how we can strengthen the fact that it is spread through both airborne and droplet transmission.
Okay, so there's a difference, isn't there? So if we are dealing with airborne, not just droplet transmission, this brings into consideration obviously adequate PPE for a lot of people, including, for example, drivers driving people to hotel quarantine, but even potentially surgical masks, which are what, the masks that you all have on now, surgical masks versus N95 masks.
Look, that's probably, Minister, if you want to go to Dr. Lyons, who's looking after the...
Okay, we'll go to Dr. Lyons, who's quietly not got any questions, so it's time to call the doctor in.
Dr. Lyons.
Thank you.
Okay, and thanks, Minister and Kerry. So the infection prevention and control guidelines that New South Wales Health has been continually revising and updating have been revised to reflect the increasing knowledge and awareness of the routes of transmission, and the advice about what PPE is required in what settings has also been revised to reflect that as the awareness has evolved during the course of the pandemic. That's then reflected in advice that goes out to all of our services and is available on our website for general consumption around what PPE is required to be used. And that has been reflected, I think, also in our assessment of the level of risk that has been, we have had at various times during the course of the last 12 months. And that assessment has been undertaken each week by a risk panel that has public health, infection prevention and control, and has advice from experts around what level of PPE needs to be worn. And as you probably are aware, we've moved our assessment levels at various times depending on the level of community transmission. So right across
Dr.
the
Lyons,
state...
can I just jump in there then? Thank you. Can I just jump in then? So I'm just looking at the latest New South Wales Health advice. I think something was tweeted by New South Wales Health on the 14th of August that lists a range of different things that people can do to protect themselves from COVID, but nothing in here in relation to ventilation or air filtration, nothing in here that tells people to open the windows of buildings they're in. Why is that?
So if I could, the question was directed around PPE use in relation to level of risk, and that was what I was responding to. So that guidance is not around the more general measures and the public health measures that would need to be undertaken to minimise risk in different settings. But I think those general messages have been continually conveyed, as Dr. Chan had indicated, about the need to ensure that activities are undertaken in an environment where there are less people, where if possible, they can be undertaken in an outdoor setting that is safer. The requirements to use protection that reflects protection against droplet as well as airborne in different settings, that's very clearly indicated. But that is not in the advice that we send out around PPE use and the delivery of care and in different settings.
Because of course, thank you, but because of course, if we're dealing with COVID, particularly as a airborne transmissible disease, which a lot of public health professionals, I understand, have been lobbying the New South Wales government as well as the federal government to recognise that it is, way back at the beginning of the year, in fact. But most of the communication from New South Wales Health still suggests that it's transmitted largely by droplets. So will New South Wales Health change its advice, update its advice to reflect the fact that COVID-19 is airborne and that people need to do much more to protect themselves from it if that's the case?
So the advice that we follow is the advice that comes out of the Australian Health Protection Principle Committee, and they have a position around what the transmission of COVID-19 and the extent to which it's spread by airborne or droplet, and that's the that's the position that New South Wales Health takes in relation to its advice. It's consistent.
Okay, so you're comfortable, Dr. Chan, maybe, but you're comfortable with the level of advice at the moment from New South Wales Health. If I look at the advice that was circulated for people to protect themselves from COVID on August the 14th, this is on New South Wales Health's Twitter stream, that does not mention ventilation. It doesn't mention air filtration. It doesn't mention making sure potentially that if you're driving somebody, you should have your windows down in the car.
Kate, so can I just say, as someone who stood up at about 500 press conferences, the number of times this has been mentioned publicly is in the hundreds. And I just can't believe actually that you're suggesting that this hasn't been put out. And I'll tell you what, instead of just giving the good doctor and Dr. Chan a lesson in what you think should be done, they will take it on notice. They've indicated they will, and they will look at those issues. So can we move on with another question, please?
Could I perhaps just answer the fact that we've banned carpooling for that very reason? That we've recognised, we've taken many actions which recognise that transmission is occurring. Right from the get-go, we've said when you get into a car, sit right at the back and have the windows down. So I'm sorry if there's been any confusion about our, one of the challenges is we also get criticised for putting too much content in messages and losing the key facts. I mean, I think there is a large amount of information we've got to convey to the public. But I think your points about ventilation are so important and how we can minimise risk. I'll talk to the communications team about how we can potentially strengthen some of those messages, particularly as we get warmer. We have got a beautiful environment and we can move to utilising those safer environments outdoors.
Is it my turn, Chair?
Thank you. Sorry, yes, I believe it is. Yeah.
You had another minute, Kate, but...
do I? No, can I? Sorry, that's good. I'll jump in. I'm just getting conflicting messages on a different thing. Okay, so therefore, I appreciate that, Dr. Chan, in terms of looking at the public communication. Wanted to go, therefore, to healthcare workers and the protection for healthcare workers, if indeed COVID is airborne, which I think you're suggesting, of course it is. Therefore, are our healthcare workers adequately protected with PPE if that's the case? For example, I think like eye protection is absolutely fundamental, as well as, of course, adequately fitted masks and N95 masks, not surgical masks.
I'll ask Dr. Lyons to answer that, Kate, but I just clicked on, just out of interest, New South Wales Health's website, and I can see gather outdoors and large well-ventilated indoor spaces. So I don't know what you're reading, and I don't know what you're listening to, but Dr. Lyons, would you like to answer about PPE that we have 10 warehouses of for staff?
Thanks, Minister. So, yeah, we have over $1.1 billion worth of PPE available for use for healthcare workers across the state. And there is very clear guidance about what level of protection is required in what circumstances. And as you indicated, where there are high levels of community transmission, and we are currently at the level of red alert right across the state, that means that healthcare workers have access to eye protection, whether that's through face shields or goggles, as well as P2N95s when they're working in situations where they're treating COVID patients or patients who are on a suspected COVID pathway. To support that rollout, we have provided fit testing for over 40,000 staff in the highest priority categories to start with, and then increasingly in other categories to ensure that those P2N95 masks are masks that fit them appropriately and provide the appropriate protection for them. And we've increasingly provided advice about what level of protection is required in clinical settings generally, and have been on the more cautious side as we've had hospitals that have had outbreaks within them, about ensuring that staff are also thinking about not just the fact that they may need protection from patients, but they may also have colleagues who have inadvertently become infectious and are bringing the infection into the work environment. So those advices have been ongoing, revised every week. The assessment, as I said, has been undertaken around the level of risk in various situations across the state every week, and advice has gone out about the level of protection required. And we're very conscious that we have absolute requirement to provide equipment for our staff to maintain safety and to continue to be able to provide safe, high quality care to their patients.
The Honourable Emma Hurst, Deputy Chair.
Thank you, Chair. Could I just clarify what the official health advice is for people who are eligible for Pfizer or who have been recommended for Pfizer because of underlying health conditions? Is the advice that they should just go and get the AstraZeneca, or should they be waiting for the Pfizer if they can't get an appointment until November or December?
So the health,
Go on, Dr. Chair.
sorry, the health advice is that there are a group of people for whom AstraZeneca is contraindicated. So if there's a clear contraindication, then it means that we would not recommend it. There may well have been people where the GP has provided advice that they might indicate that Pfizer is more appropriate in this circumstance, but it's not based on a contraindication. I would just urge everyone at this time to discuss with their GP their particular circumstances, and clearly, my advice to the general public is that we should take up the opportunities. We have 2 safe and effective vaccines. Obviously, both have different adverse event profiles, and it's important that everyone is informed about both vaccines and the adverse events, because there may be in some cases where AstraZeneca is preferred over Pfizer as well. So I think it is important that there are clinical discussions, but in the context of risk, the risk threshold for individuals has changed significantly given the current outbreak, and it would be important to have that additional conversation with your GP about what they would recommend for you.
Are you concerned that people are waiting for appointments in November to be able to access certain vaccines? Is that a concern?
My advice, and I think I've been giving it every day, is to reassess that risk benefit. There is a real risk of you being exposed to COVID and the consequences of that, and that has to inform your decisions. I think I've given the example that my son's gone off to have an AstraZeneca. He's in his 20s. Of course, there is going to be more Pfizer supply available, but at the moment we have 2 very good, effective vaccines. And the thing that gives me heart at the moment is just the massive rollout and uptake of the community to vaccination, because I think they understand that having those very high levels of vaccine coverage is what's going to allow us to get to a point of living with COVID. But we need to have very high levels, and so everyone has a part to play in achieving that.
Thank you. There are a lot of people in the community also concerned about the fact that greyhound racing and horse racing are allowed to continue despite the lockdown. And there was an event not long ago in Coffs Harbour, a horse race with 2,000 people attending. Was there any health advice regarding this event and allowing it to continue?
I can't answer the specific event you're talking about, Emma, but the reality is that we live in a world where we would like to have as much normality as possible. And so there have been decisions on that aspect, and also economic issues weighed up right throughout this pandemic. And any of those events have been obviously developed in a COVID safe way. Each of them are required to have a COVID safe plan. Wouldn't matter what it was, it's a major event going on, and there aren't that many of them. They are worked through with our public health team in a COVID safe way. And to my knowledge, there's been no issues arising out of any of those issues, except that it obviously allows part of the world to be operationally normally.
Under the current public health orders, are racing participants allowed to travel from Sydney to regional New South Wales to participate in horse and greyhound racing?
If they're working, yes. Every now and then we hear of somebody trying to push the rules, and generally they are stopped from travelling if they're not directly involved. But obviously there's some capacity to do that.
And can I ask Dr. Chan, has there been any health advice in regards to these particular industries and the travelling, particularly to regional towns, for this particular industry and the risk that it could be causing?
Sorry, that's the first time I've been aware of that issue. We certainly, from a public health perspective, we are very concerned about regional seeding.
Sorry, can I just emphasise here, Dr. Chance, there's another Dr. Broom,
yes,
who actually handles this. It might be her first time, but Dr. Broom, I was talking to him only yesterday about similar issues. So he's very aware of all these issues, and so part of her team is dealing with this. That's what I'm saying, there's a whole lot of different health people who actually work with these different issues. So if you have any particular issues that you're worried about, we will be worried as well, so let us know. And I've had calls to me about these issues, and I raise them with Dr. Broom, and Dr. Broom makes sure that everything's done in an appropriately safe way.
So, Minister, has Dr. Broom sort of commented on this particular industry? Like, I mean, I guess, some of the questions that we've been asking is about, tennis courts being closed down and other sort of recreational facilities for, people that are already doing it tough, to allow sort of a gambling industry to continue and to prioritise that over other things that are really good for people's mental health, for example. Has Dr. Broom considered that or had any discussions with you in that regard?
Just in terms of the broader issue, can I say generally tennis courts are not closed down. Most of the opportunities where, as Dr. Chan said, if you can be spaced, there's a balancing act here that is being tried, that the health people are trying to achieve. I think sometimes what I hear is interpretations by others other than health as to what is required. So, I mean, I heard last week that you couldn't go and visit the Rookwood Cemetery to actually be there with, your relatives. But that wasn't a health issue. It turned out to be a local police issue interpretation. I think these sort of things happen when you're in the middle of a pandemic, that local councils interpret things differently. I mean, you might remember last year, I couldn't quite understand why we had so many areas closed off by councils. I think those issues just need to be dealt with in a common sense way. But if you've got any particular issues, raise it with me, and I'll put you in touch with Dr. Broom. You can have a chat with him about it. And if there are any issues, of course, that are problematic, then Dr. Broom would give us that advice, and we would take the appropriate steps.
Thank you. We will be in contact. I just have
another. Also emphasise it's not just Dr. Broom. He just happens to head up that section of Dr. Chan's team. He's got a whole lot of others who work with him as well, and there are another 12 public health units around the state as well. Depends on what part of the state you're in too.
Fantastic. I've just got one more quick question because I know you have to get to the press conference. I just wanted to clarify something in regards to the single bubble, because I know that the single bubble was announced, and then after that was announced and people had chosen a single bubble person, several other LGAs then went into further lockdown. In those new lockdowns of concern, if they had chosen a single bubble person that was outside the 5 kilometre radius, are they able to now pick a new single bubble person that is within their 5 kilometre radius, or do those people now go without a single bubble person?
No, they can have somebody else. Obviously, yeah, sure.
Okay, thank you.
Thank you, Deputy Chair. Well, that brings us to 11 a.m., which is our scheduled rest pause for 15 minutes. So I know, Dr. Chant, you have to get away. I'm not sure whether the Minister is joining you, but once again, on behalf of everyone, I thank you, Dr. Chant, for your tireless work in helping us get through this most difficult time. It's profoundly appreciated, and we know how hard you work. Thank you very much. We will now have a break for 15 minutes and be back at 11:15 a.m. sharp. Thank you. Yeah.
Oh, yeah. Which handle was broken? Oh, yeah.
Pat?
Doctor.
Welcome back, everybody, to the next session of our budget estimates hearing this morning for Portfolio Committee number 2, Health. Before proceeding, need to swear and affirm some additional witnesses who are joining us for this session. I note the presence of the Minister with us again, so thank you, Minister, for making yourself available for the next session. I know you're very busy, of course. But working through our witnesses, one at a time, Dr. McAnulty, could you please state your full name and position, title, for either an oath or an affirmation, whichever you prefer. The card should be before you. Please proceed.
I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God. My name is Dr.
Thank you, Dr. McAnulty. Mr. Minns, please, could you proceed?
Philip Gregory Minns, Deputy Secretary for People, Culture and Governance in the Ministry of Health. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you, Mr. Minns. Ms. Walk, please state your full name, position, title, and swear either an oath or affirmation.
Good morning, Rebecca Sharon Walk, Chief Executive of Health Infrastructure. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you very much, Ms. Walk. And Mr. Lorenzo, could you please state your full name, position, title and swear either the oath or affirmation. Mr. Lorenzo, are you able to join us now? Just checking. Does anyone know where Mr. Lorenzo is?
Yes, I'm here. Hello.
Great. Welcome. Could you please state your full name, position, title, and swear either an oath or affirmation?
Yes, Michael Di Rienzo, Chief Executive of Hunter New England Local Health District, and I swear the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. So help me God.
Welcome, and thank you very much for joining us, Mr. Lorenzo. We'll commence our questioning. We will proceed with 20-minute blocks, commencing with the opposition.
Thank you, Mr. Chair. This question is probably to Dr. McAnulty. What decision criteria is used to determine where the mass vaccination hubs are actually located?
Can I just say,
okay.
Well, that that's the question that probably should have gone, not to, well, can't go to Dr. McIntyre, you can, but he can't give you the answer. That one actually is Susan Pearce. She was the person who was here before talking about all those mass vaccination hubs. But I can tell you this much. But in the initial stages, it was just the federal government didn't seem to think that mass vaccination hubs were the go, but New South Wales Health senior officials discussed it and determined that if and when, and there was a big if and when at the time, we were able to get sufficient vaccines from the federal government, then it would be helpful if we could move it out in very substantial numbers. So there was a lot of discussion about that at the time, and I remember that Dr. Teresa Anderson, who's the Chief Executive of the Sydney Local Health District, was involved in those discussions, and so the first three that came up were actually hospitals, because we had a particular task to do, which was principally around the 1A, 1B categories that we'd agreed to help the federal government on. So there was Liverpool, Westmead and RPA. And after that, they then started looking around for another major vaccination hub that was centrally located. That was the real criteria at that point. And so they looked geographically and they found that somewhere towards Sydney Olympic Park would be accessible by a large number of communities. And initially they were told there were no buildings available, but then one of the amazing health staff got onto realestate.com and found there was a large building that could possibly be converted. And then they took a lease on that within a week. And within 3 to 4 weeks, it was set up completely with all IT and everything else to get it operational. And I think many of your colleagues have been to that particular vaccination hub, and it has been just remarkable what the health team and the police and everybody else, security people and so on, have done there. And then they started looking at where else they could go, and of course wanted to move into the regional areas. So they come up with, in fact, I remember I rang the head of Bunnings to see, because we were told there was possibly a Bunnings up at Belmont, North Belmont, to try and get one up to the Hunter. That came out of communities actually suggesting in that area that perhaps that would be a good location. And I remember I also got a message from a surgeon that was up in the Hunter suggesting that particular facility because it would suit, it was a good central location for the whole of the Hunter. So we've been progressively doing those sorts of issues looking. And then on top of that, of course, there's all the pop-ups that are going on now in the local areas, and people like, or groups like the Lebanese Muslim Association have worked with the government, or worked with New South Wales Health to say we think we should have centres here, and the various ethnic groups, particularly in southwest and western Sydney. So we've got a lot of different pop-ups in Sikh temples and church grounds and all sorts of things. So that's how it's been done largely.
Now, Minister, you made you'd probably be aware that Blacktown Council wrote to you in July offering vacant facilities in Blacktown. Why was that approach rejected?
I certainly haven't rejected it, and I think what's happened there, Mr. Secord, is that I've raised these issues whenever I've had a suggestion. I raise it with the Deputy Secretary Pearce, and as far as possible, she has been doing whatever she can to get centres set up. But I think the big issue is New South Wales now leads the country, leads the world, is the advice I've had in terms of the rate of vaccinations. And so the challenge that Ms Pearce has actually put back to us each time is we've only got X number of staff to be available, and if we can get more staff, then we can do more. But we also requested in a letter about 2 weeks ago to the federal government, for precisely those sorts of reasons, to ask for assistance in southwest Sydney. Thus far that hasn't been possible, but they have actually provided staff for the outbreak areas up around Dubbo, Burke, Wilcannia and so on. But it really comes down to, can I say, essentially a staffing issue and just capacity, supply. The Secretary would like to say something on this, so I'll just pass to Ms Coff to actually add anything that I've missed out.
Thank you, Minister. One of the critical factors has been the constraint of supply of vaccine, and the capacity to roll out, obviously, the Minister said relates to staffing availability. But if you don't have the vaccine available to be able to administer to patients. There's no point setting up extra locations. The hesitancy associated with AstraZeneca also was problematic for us. So we've been working very hard with the Commonwealth to secure additional supplies, and we were delighted when last week they announced the extra 530,000 vaccines for New South Wales. But that's been another factor that's a rate determining factor in our capacity to establish vaccine locations and centres.
Now, Minister, you mentioned earlier, you made reference in your previous answer to Western New South Wales. Last night, ABC television showed footage of testing sites at Dubbo and Bathurst, and there was no one at the sites. Why did that occur? Was it a location? Why were they absolutely vacant?
I think that comes down to the problem of the intersection between reality and people's psyche, if you like. I don't know specifically the answer, but I looked at that and just, I saw the same news report, and I just thought, well, people in that area have yet to realise that the virus is quite possibly coming in substantial numbers. I know in Dubbo it was a different ballgame, but in Dubbo, where they've actually experienced quite a number of cases, there were a lot of people getting tested. And on the ground, I'm hearing that up in some of the smaller towns where they've got cases and there's real awareness that people are being tested. But it's like, seriously, I mean, 8 weeks ago, trying to get people in Sydney to get vaccinated was a bit of a challenge. But as a result of the outbreak of the Delta, we're now seeing the highest rates of vaccination. It comes down to the psychological perceptions that people have.
Now, the people who are being treated in Western New South Wales for COVID, the rural and regional health inquiry, there was mention and there was evidence provided that there were hospitals without doctors on the weekends. So what is happening in Western New South Wales in small communities where people come forward or are found to be COVID positive? What happens to those patients?
Well, being COVID positive, Mr. Secord, doesn't mean that you're necessarily sick. It means that you should be self-isolating at home, and the people beyond Sydney and heading west, there are two local health districts. One is the Western Local Health District, and one is the Far Western Local Health District. So by the time you get to, for example, Canning and Broken Hill, that's in the Far Western Local Health District. The ones who are a bit closer in towards Sydney are in the Western Local Health District. And those teams are working collaboratively. I know I've spoken personally, though I suppose it's not a minister's task generally to get involved in delivery at a local level, but I always try and talk to the senior staff and make sure that they're getting what they need. And from what I understand, from the senior officers, senior health officers in both of those local health districts, they're working together. But they've also, in the last few days, they've had the federal government ADF people arrive, and they are doing a very good job supporting the local health districts. But people who are positive have to be assessed in terms of whether or not they need to be hospitalised, and or, of course, once they get to hospital, then there's a medical assessment made on whether or not they need a higher level of treatment. Sorry, can I finish? So it really does depend on the level of being positive and the outcomes. What are their symptoms? And how likely they are to need help. I'm told, I haven't spoken since Saturday, I think, to Maclaren, but I was told that there were a few people who'd been transferred into intensive care, and I think it was at Dubbo Hospital. And the other major hospital out that way is obviously Orange, so there's a possibility that they could be there. But does anybody else have any updates?
Yes, I do.
Ask the Secretary, Walt, so she can give you an up-to-date position.
So there's an emergency operations centre that's oversighting the total response out there. Yes, that involves both the Commonwealth deployment, the local police, the health people. AUSMAT's also arrived. They're the Australian medical emergency teams to support the effort out there. As of this morning, in terms of the cases, there are 301 cases in total in Western New South Wales. 13 patients are in Dubbo Hospital and 1 patient is in Orange ICU. And I think that's the critical issue, that we monitor twice a day what the demand is on the health system. And in far Western New South Wales Local Health District, we have 19 positive cases reported in Wilcannia overnight and nil hospitalisations at this stage. However, we're closely monitoring the status out there in conjunction with the Royal Flying Doctor Service, the Defence Forces, the AUSMAT teams, and supporting our clinical efforts. Yes. The other point that I'd make, and on today's press conference, Dr. Nee Nguyen was part of the press conference today, and she takes a leadership role across the whole of the state for intensive care unit bed capacity. And one thing about our New South Wales health system, it's very well networked. No district is left to attempt to manage this on their own, and there's quite an integrated network of ICU clinicians to support and, if necessary, make decisions on definitive care.
To give context, when you say there are 13 patients in Dubbo Hospital in ICU, how many ICU beds would there be at Dubbo? How does that sort of equate in context to demand?
Look, I can't tell you, but I did say 13 patients in Dubbo Hospital, Mr. Secord. I didn't say ICU. Oh. I don't know the exact number. I'll take it on notice.
And are patients still being transferred from Southwest Sydney to Wollongong for hospitalisation?
If that's a clinical decision, Mr. Secord, I mean, as I think you were Shadow for Health for a while, which I think.
For 5 years.
Yeah. For 5 years. So, and you asked some very good questions during that time, but I don't think you ever discussed the network. The network system is what our health system operates on. So they do transfer patients between hospitals as appropriate.
When you say the network system, so network, does that occur when a hospital is at capacity?
It can occur for a whole variety of clinical reasons or other reasons. Mm-hmm. And it's made, can I say, it's made on a sound medical basis. The physicians run those things. It's not like, they're the people who make the decisions. I think we can have faith that we have the best health system probably in the world, so they make good decisions.
I think I'll just ask a couple of more questions just for my benefit of my colleague Courtney Husos. There's been much talk about a first and second jab, and we now know that countries like Israel are now providing booster shots, third injections, and information came out yesterday that Pfizer has reported that there's an immunity dip at 6 months after a second jab. So what are the provisions in New South Wales for a third jab? For example, if you had your second vaccination in June, you'd be ready for your third booster by Christmas, January.
Can I just say, obviously there's a lot of work going on, as Dr. Chant said earlier, about the intricacies of evolving understanding of the vaccine efficacy and various vaccines efficacy. And that has to be put in the context, obviously, of what the environment is in terms of the spread of the disease. The federal government's advisory body is obviously considering those issues. And I don't think there will be any clarity for the moment, but I'll just ask Dr. McAnulty, as he's the doctor in the room, whether he would like to add anything further to that.
No, thanks, Minister. I think you summarised it, that it's a new disease, new vaccine. We're learning as time goes on. We rely very much on the experts of the TAGI and other national bodies to make those very critical decisions.
But based on that information, would we have supply and capacity to begin the third round if in fact overseas experience shows that in fact a third booster is needed 6 to 8 months after the second?
Well, the short answer to that is there's the expectation at the moment from the federal government that they can supply vaccines going forward for all that is required at the appropriate time. But obviously, at the moment, whilst New South Wales is very well advanced in regard to delivery of vaccines into arms, and in fact leading the country at the moment, there's no clarity on just at what time we'll move to the focus on boosters. That depends very much on what happens with the rest of the country. And I'm hoping that you've probably seen the commentary just the last few days about various leaders giving us the benefit of their wisdom in terms of whether they will open up or not open up, depending on numbers, depending on vaccines. Short answer is we've all got to get on and get vaccinated extremely quickly. And hopefully all states and territories will achieve that, subject to what you were talking about before with the percentages from the Donnelly as to whether or not you include children. But when we get to the 70 to 80% across the country, then we'll be able to open up. And at that point, the federal government has not indicated any likely problem with getting boosters as they progress. And it may be an entirely different vaccine. I mean, there obviously there's a lot of work going on overseas as to whether or not you can mix vaccines even in the first two jabs. Then what you actually have won't necessarily be AZ, won't necessarily be Pfizer, won't necessarily be Moderna by the time we get to that.
Thank you.
I don't have clarity on that at this stage, but the New South Wales health system can't tell you more than the federal government, because the information comes from the federal government and through ATAGI. And but again, I'll ask Dr. McAnulty if there's something I missed. He might like to add it. If not, well, that's all we can tell you, Dr. McAnulty.
No, nothing further. Thanks.
Nothing further.
Thank you, Minister, and I'll hand to my colleague Courtney.
Very much. Minister, we've just heard at the 11 a.m. press conference of another death as the result of the outbreak at Liverpool Hospital, taking the total number of deaths as a result of that outbreak to 11. There have also been, as we said earlier, outbreaks at Nepean, St George and Westmead hospitals. What were the lessons learned from this outbreak, and what changes are being made as a result of them in the way that COVID is managed in New South Wales hospitals?
Again, I think that's something that really should have been asked to Dr. Chant, because she is the epidemiologist expert on these matters. But what I would say, Courtney, is that I think each one of the cases can be a little different. And so there's constant learnings going on. I think Dr. Chant did say that point a little earlier, that there's constant learnings going on. But if you look at the issue around, for example, say Liverpool, in the mental health, not Liverpool, Nepean, in the mental health unit there, I mean, they had a patient who came in who was going into what is quite a complex situation with a lot of thought disordered patients who really do need the highest level mental health care. And that patient became febrile on day 2, or just moving into day 3. By the time that happened, as you would know from all the press conferences, a patient could have been positive, but without symptoms for the previous 48 hours or so, even when that's not precise, that's approximate rule of thumb. And so there was immediate expectation that there would be a substantial number of the other patients, because they mix in together as in their daily activities, would be also possibly positive. That turned out to be the case. And of course, there was then the issue of the staff who were there, and very challenging because those staff are highly qualified mental health staff. And so the whole system has to be looked at in a broader sense. Do we have available mental health staff? Can they come in? Can you furlough them? And again, the issue I think remains around trying to get enough vaccine, as the Secretary said before. It's always been a challenge. So supply of vaccine, trying to get it into medical staff's arms, and then recognising also there have been some staff who have been a bit slow to move to have the vaccines, which is why at the present time I announced, I think last week or the week before, that New South Wales Health would move to mandate having vaccines for front-facing staff, patient-facing staff. Nobody else has done that in the country yet, but we're moving towards that, and hopefully the national government will at some point agree on that. At the moment, they've only agreed on that for aged care. So there are many factors that come into it. It's the most complex algorithm.
Minister, my time has expired. Can I ask when the mandatory requirement will be in place for health workers?
Well, your time has expired.
Can I answer the question?
No, excuse me, David. I'm chairing this meeting. A question was being asked finally. Please proceed with that question.
Courtney, we had a meeting last Wednesday or Thursday with all the sector, and we're just working through a couple of the issues with particularly the major unions, the Nurse and Midwife Association and the HSU. And I'm hoping that we can find a nuance, the answer to that, so that we can then go ahead with what we know we have to do. And with a bit of luck, I might get those orders signed this week, but I'm just going to make sure that the sensitivities of the union about particular issues is sorted out.
Thank you. David Shubridge.
Thanks, Chair. Minister, do you support having changes to workers' compensation laws to ensure that if any health worker has an adverse reaction to a vaccine that they're required to have, that they will be guaranteed protection under workers' compensation laws? Do you support that from a health perspective?
Thank you, Mr. Shubridge, for that question. But as Health Minister, my task is to make sure that people are kept safe patients-wise, and I'm going to leave that issue to my colleagues who will be dealing with workers' comp. It's not a matter for me.
Minister, if you're going to be directing your staff to be vaccinated, surely you have an obligation to ensure that they're protected if they have an adverse reaction. What's your position, given you're going to be giving that direction to your staff?
My obligation is to make sure that patients and staff are kept safe, and that's where all I'm prepared to say at this point. If you want to ask those sorts of questions, speak to the relevant minister, not me.
Minister, yeah, indeed. Minister, did I understand that there were 19 cases in Wilcannia in the last 24 hours? Was that the evidence?
I'd have to ask the Secretary. Do you have those up-to-date figures?
Yes, I do. Yes, that's correct, Mr. Shubridge. 19 positive cases reported overnight in Wilcannia.
And that adds to more than a dozen on Sunday. Do you not have the cumulative total in Wilcannia now?
Not at my fingertips. I get the twice daily update, which gives progression on what the update is, but we can take that on notice.
What Aboriginal controlled health organisations are you working with on the ground in Wilcannia to respond to this emerging crisis in the community, and what resources have you given them?
The Aboriginal medical services are federal government sponsored, Mr. Shubridge, they're not ours, but we're working with them. So, for example, last week I had, I think, 3 or 4 conversations with a number of people, including particularly the Walgett Aboriginal Medical Service. It's a very large medical service. It's actually the biggest medical service by a long shot for many, many miles, many kilometres. So the state has... I don't think you were here before the morning tea, were you, or were you? Did you just come in?
I was, thank you, Minister. I don't need an update on that. I was asking what resources the state government has given to Aboriginal controlled health organisations in Wilcannia to help them deal with this crisis. And I think the answer I'm getting from you is nothing. Is that right?
Actually, David, I didn't say that. And I actually thank you yet again not to put words into my mouth or the health officials who are working very hard. I don't know why you insist on having such an obstructive way of asking questions. Would you like to highlight yet again what you've already said, because you probably didn't hear it before?
Look, our government agencies are working collaboratively with Marimar in particular and all the Aboriginal medical services to deliver the services prioritised for those communities.
What additional accommodation has the state government provided to people needing to isolate in Wilcannia, given how crowded the housing conditions are, especially amongst First Nations peoples?
Mr. Shubridge, I'm told by the local health officials that they have been working in a very limited circumstance, a very challenged circumstance, to establish some sort of alternative accommodation arrangements for them. Having said that, it's a collaborative whole of government, including federal government approach. And I remind you again that the principal and primary responsibility for Aboriginal people is the federal government, but we are certainly doing everything on the ground that the New South Wales government can do.
Minister, have you spoken with the Darrawa Elders group from Walgett, who for more than 12 months now have been asking for urgent attention and resources for their community in Walgett? Have you spoken directly with them at any time since the COVID crisis has opened?
David, I'm sorry, I'm not going to get into it with you as to who I speak to on a daily basis, but that's just ridiculous to ask me that sort of question in this conference.
Minister, have you seen the request for additional resources and help that's come from the Darrawa Elders group in Walgett? Have you seen that request, and have you sought to try and satisfy that request to deal with that?
Well, I'm aware of, Mr. Shoebridge, is having spoken to the health teams up there, that they are all working very closely with the communities, and they will continue to do that, and the federal government as well.
Minister, the Darrawa Elders group have asked, for example, for resources and support for wellbeing checks and essential items such as medication, food boxes and water supplies, so as they can be distributed by trusted community members. Are you willing to help them out with that and provide those resources?
That will be conveyed to the team up there if it hasn't already been, but I understood it had been. But if you think it hasn't been, I'll make sure that that's conveyed to them.
Minister, what arrangements are you doing through the Justice Health portfolio to ensure that there aren't people being released from prison? And in this case, someone was released from Bathurst Jail, who eventually was COVID positive and then went into remote and regional New South Wales. What arrangements are you working with Justice Health to ensure that doesn't happen again?
Justice Health have actually reviewed that situation and working with the prisons authorities to ensure that where possible inmates are, particularly in that situation, because the particular inmate that I think you're referring to was only in there for 2 days. And so they've taken some steps to try and address those particular concerns.
Minister, what are those steps? Because on my understanding, that inmate was tested for COVID on Saturday and then was released on Monday, and the community still doesn't know if Justice Health was aware of the COVID positive nature before the release, or if after, when Justice Health became aware of the COVID positive. Can you provide any insight into that?
My understanding is you're right insofar as there was not a result, but the justice system was the intersection between, if you like, health and the civil liberties that we should all respect. The person was allowed to leave. There was some discussions about whether health orders should somehow be involved in the proceedings, and in the end, the decision from both prisons and justice, more broadly, and health was that the justice system should not be impinged by keeping people locked up longer than they should be. So they were taking some steps to try and look at alternative measures of making sure that people are tested and supported in ways that would not necessarily have them disappearing off to, not disappearing, that's the wrong word, heading back to their own communities before those results were in place. But I'll get the details for you if you would like that in due course from the people on the ground.
Well, Minister, yes, that would be good. Thank you. Provide that on notice. But can you answer this question? Was Corrective Services or Justice Health aware of the COVID positive test before that inmate was released?
Not to my knowledge, no. But again, I'll find out for you, but not to my knowledge.
Minister, given how fragile the health is of many of those regional and remote New South Wales communities, do you support the Prime Minister's call to start watering down lockdown arrangements when we have 70% of adults vaccinated? Would that include regional and remote New South Wales?
I think as a principle, I would have thought that I share the same view as you on this, which is remarkable, but I would have thought that lockdowns should be avoided if at all possible. People's civil liberties shouldn't be impinged. Having said that, obviously those are issues which are the complex discussions that take place in a 1 in 100 year pandemic. So I think at this point, my focus as Health Minister is to make sure that the people who are in the regional areas, particularly in Bree and Wilcannia and Gaduga and all those smaller towns, are getting the support they need to try and bring the numbers down. It was always a risk right from the word go. I remember back in March, April last year, all the Labor and Liberal ministers around the country, health ministers, all identified that if the virus got into Indigenous communities around the country, it would be very challenging to manage it. Obviously, cultural issues come into that. So my focus at the moment is to try and ensure that we get the adequate support from the federal government, but perhaps, well, not perhaps, but is needed. Obviously, if there have been vaccinations done in greater numbers by the federal government earlier on, we may not be facing this challenge, but I also understand the pressures the federal government's under. So it's not a case of blaming anybody, it's just a case of managing.
I'm moving now to the Deputy Chair, the Honourable Emma Hurst. Emma.
Thank you very much, Chair. It's been reported that New South Wales Health is taking a new approach and no longer listing every metropolitan COVID-19 exposure site publicly. I just wanted to get a bit of a better understanding about the reasons behind that.
Emma, I'll ask Dr. McAnulty to answer that for you.
Thank you.
Thanks, Minister. We've got a lot of experience in last year and this year with the Delta virus about where transmission is likely to occur for COVID. So based on that information and based on the knowledge that consumers were being lost in the detail when there were many hundreds of venues being listed on the website and in the media and getting confused and not seeing the important venues of concern. So we've taken the approach which is to focus on those venues where we believe there is a reasonable risk of transmission, which primarily is, most transmission occurs in people's households, or when they're visiting other people's households, or at work, or in high-risk settings such as healthcare or aged care facilities, childcare. So we're focusing on those areas as well as where we have some other reason to believe there's an increased risk of transmission or where we know transmission has occurred. That's in the city areas. In the country or regional areas where there hasn't been many cases, we're continuing to list venues with much lower risks as well. So we're taking a gradated approach based on what we believe the best focus for the resources are.
And just sort of going off that answer about, the places of highest risk, and I think it's also been said as well in past press conferences that there's a lower transmission risk during exercise. However, the areas, the local government areas of concern have now been limited to 1 hour exercise a day. Is that because there is some concern in those LGAs that there are transmissions while people are outside exercising?
That was obviously very difficult decision making there and complex. Generally, you're far safer being outside, there's no question. And the problem that the police highlighted was that in those particular LGAs, in particular areas particularly, there were gatherings of people when they were out for exercise and the police were finding it a little challenging to deal with. And so as a part of a suite of recommendations that was put forward to try and minimise the gatherings, that was put forward. But yeah, hopefully we'll be able to get through this as quickly as possible. We can get back to people being able to for a more free lifestyle.
But the people that are going outside to exercise, for an hour or something like that, they're at a fairly low risk if they're abiding by all the orders to try to sort of avoid people and wear masks, etc.
True.
Okay, thank you. I was going to ask as well about the efforts to encourage people over 60 who haven't been vaccinated. And I was wondering what steps, if any, are being taken to actually further encourage older age groups to go out and get vaccinated.
Look, I think the
Secretary's going to answer that one, Secretary Koff.
I think it's important to reflect back on the journey of the vaccine rollout, and we actually started with priority groupings of professions and then shifted to an age-based cohort. And based on the experience of COVID with good old Alpha, it was the older age groups that were the most seriously impacted health-wise. So we started on decreasing decades going through down the age cohorts, and we worked through those age groups. And as it stands at the moment, our older citizens in those age groups do have very, very high vaccination rates in comparison to the younger cohorts, because we only opened it up to the 16 to 39-year-olds when we got the additional supply. But we published the vaccination rates of each of the age cohorts, and happy to provide that to you.
Having said that, Emma, Dr. Chant has highlighted in a number of press conferences recently, I think a frustration would be fair to say, that some people over the age of 60 have still not come forward to be vaccinated. And so I think the short answer there is that Dr. Chant's message is anybody in that age bracket, to anybody who's eligible in the older age brackets for AstraZeneca, should just come forward and get it. And certainly, I mean, I'm obviously somewhat older than 21. I had it, Dr. Chant's had it, the Premier's had it. I think the short answer is everybody should come out. The luxury of not having it might have been there before we had this current outbreak. I think, in a sense, we were a victim of our own success last year. People became far too overconfident, thinking, well, it's not going to come here. And the reality is Delta is rampaging across the entire world. And anybody who thinks it's not going to come to them at some point is kidding themselves. It'll come. So get vaccinated.
Yeah, thank you. I also understand that Westmead Vaccination Hub has been shut down, and I was wondering what the reasons behind that was.
If that's the case, I'm not aware of that. It may be because...
No, sorry, I took my mask off. Sorry, I just took my mask off and realised I shouldn't because I was talking. In terms of establishing the large high-volume centres, so Kudos Arena was the one most recently opened. We've redeployed some of the staff because I think, as Minister mentioned earlier, our capacity to staff these venues is absolutely critical, and to get the highest volumes through, it's best to do with those large centres. I think if I made a plea just for people to note, the health system is doing an extraordinary job in managing the vaccine rollout. It's still managing the COVID testing, pop-up clinics and the pathology throughput, and still managing a health system. The health system has responded. The staff are absolutely extending themselves, and we have to deploy the resources where I think the priorities are, and putting the throughput through Kudos was a critical issue that Western Sydney Local Health District made the decision to do.
So can I just clarify, is Westmead Vaccination Hub open, but it's sort of smaller, or has it actually closed down and moved to Kudos?
No, we redeployed the staff temporarily while we're putting the high volume through Kudos, and then once again we'll reassess when we put the volumes through Kudos. Okay, so
Westmead may reopen at some point.
Can I just, Emma, can I just say, Mr. Minns is sounding desperate over here on my left to want to say something, so I'll let him talk. Love
to hear from him.
Phil Minns speaking. Look, to get Kudos to its peak daily rate, the headcount workforce required per day is in the order of 1,200. So that gives you a sense of the size of the scale and operation.
I'm going to say, I know on the ground out there I asked for some help for the federal government, but the federal government didn't seem to have enough staff available for that purpose. So it's actually been left largely to our amazing doctors, nurses, and everybody else in the state health system. So they're all working. I just want to put on record again my thanks to all the doctors, the nurses, the cleaners, the admin staff, and the team who's put those massive things together. And you had Susan Pearce here before, who is basically the queen of mass vaccinations. She has worked incredibly hard to bring it all together. But at the end of the day, you can only do what you can do with the staff that are available.
Yeah, I totally understand that. I was just sort of getting that clarification. I've just sort of got a follow-up question quickly for Mr. Minns. We've talked about how stressful, and obviously these staff are really being pushed to their limits. Everybody's doing a fantastic job, and everyone who I've come in contact with has been extremely polite and friendly given the circumstances. But what is being done to support those staff and the mental stress that they will be going through during this time?
So, Phil Minns again. Look, all of the local health districts and the facilities within them have their own strategies for staff wellbeing, which they are surging at this time. So it's a combination of existing arrangements that they have with employee assistance providers, but also some new strategies and new events, and some of it is supported by community donation. So some of the districts and some of the hospitals I know are receiving sort of care packs and things of that nature from donors.
Can I add one thing I'd say is that if you're living next door to a nurse or a doctor, make a lasagna or a cottage pie or something and drop it on their doorstep, because it is very much appreciated. They're working their butts off, and they just need to know that other people care about them.
Thank you, Minister. It's just gone 12, which means we now move across to the opposition questioning.
Thanks very much, Chair. Dr. McAnulty, what's the modelling telling you about caseloads over the coming months, given the current restrictions? How many cases are we projecting over September and October?
I will ask Dr. McAnulty, although I don't know that he's the person that would have that. I'm not sure, do you?
I haven't been involved in the national modelling process.
The problem, can I say, Courtney, is that there are multiple teams doing modelling. Federal government's doing modelling, Doherty's doing modelling. Dr. Chant, I think, spends a fair part of her day listening to people giving their input on what they all think about what the modelling should be. But the big challenge at the moment is, as long as the vaccine keeps rolling out, then that's going to change remarkably whatever's happening. I think at the moment all I could really say to you is that there's just a belief that if we can get the vaccines into people's arms, if everybody takes responsibility to get the vaccine into their arms, then we think that by the end of October, November, we should have a remarkably different environment. But the issue really is we need to get people to understand the absolute importance of staying home right now, particularly in those areas where the high viral load is. That's a particularly high viral load in particular areas in southwestern and western Sydney. If we can get people to stay home, if we can get them to stop distributing the virus amongst themselves, and we can get the vaccines in arms, then we're thinking that by around about October, November, life should be a lot closer to normal.
Well, perhaps, Minister, then you can share what's the current reproduction rate of the virus?
I think it's about, last time I looked, last time I was briefed, which was a couple of days ago now, it was about 1.2 or 1.3.
Yes.
Does anybody else at the table have that?
No, that was the last
They're nodding their head saying, yeah, that's what the RF value was, R effective was. And we really needed to get down below 1.
Yes. So, Dr. McAnulty, what is the current period between a positive case getting a text message? What's the current time period between a positive case getting a text message and when they're getting a phone call from a contact tracer?
So we have been adjusting our processes to make sure that cases are aware of their status as soon as possible. So we have introduced, moved to introducing a text message to all cases when we receive a positive diagnosis from the laboratory, and then following that up with and that text message provides some information to the person about their diagnosis, what they need to do in terms of isolating, what they need to do in terms of making sure that their close contacts are also isolating in their household and seeking testing, and if they need additional medical care, what to do, and provides a phone number. We then follow up with a more detailed interview. We have been surging workforce throughout the state, throughout our public health units, bringing on additional workers also from the military who've been supporting us. So that I can't give you the exact time figure in terms of the time taken before, but we aim to get information to each person very quickly on the same day.
Courtney, can I just add to that, when all this started, we probably had, would have been 200 or 300 tracers and people doing tracing and case interviews. But I understand that we're up to, actually I'll check with Mr. Minns, but I think we're up to about 800 or so now, is that right?
With the 60 that started today and being onboarded, we'll be pressing towards 800.
Yeah, so it's...
Sorry, I didn't quite hear that, Mr. Minns. What was the final figure?
We'll be heading towards 800 from, because we've added 60 more today, and we still have plans to add more.
So the closest damn it, it's about going to be probably fairly soon about 1,000 people just doing that tracing, and quite a few of them. I want to thank the federal government because, and I want to thank the people. We're here in the health building at the moment, and quite often in this building I see Navy, Army and Air Force uniforms, and they're heading to the floors where we do all the tracing. So thank you to each of those individuals who need to come over and help out. But the issue is that sometimes if you're interviewing people with no language problems, and no cultural issues, and a desire to tell you the whole truth and nothing but the truth, it can still take 8 to 10 hours because people don't remember where they've been in the preceding period. Then you add to that the cultural overlays, the language challenges, and everything else that goes with it. And sometimes it can actually be a week or more before you actually get a fulsome set of answers. So it's the most difficult of the most difficult to try and get all that information, and then to be able to, once you get that, then you might go back and tell somebody, well, you were actually exposed. It's very challenging.
Well, perhaps, Minister, can you, or Mr. Minns, can you tell us how long it's taking to get those numbers of cases that are under investigation to zero? Every day we see rising numbers, but the overwhelming majority are listed as under investigation. What's the time period in getting that to zero?
I don't think at this stage of the pandemic that's going to be a possibility. I think at this stage you're going to have to say that after a certain point, if it goes for a couple of weeks that you don't know or you can't get, there's going to be a point where you can't get all that information. So we're in the middle of a pandemic, but does anybody else want to add something to that? Dr. McAnally.
So we provide a weekly epidemiological report that provides updated information as the information comes in. But the Minister is correct in that there's often that we are unable to provide identified links among cases, particularly as the numbers go out. And but we do try and get that information as quickly as possible, and then that's published.
Have you considered purchasing new software to support the operation of contact tracing? Obviously, there's a limit to how many people you can get doing it, but there's also the need for improved software to support that.
There have been lots of discussions. In fact, as late as last week, I was at a meeting. Sometimes I get invited to operational meetings, and there was a meeting of about 30 people in a room, and some of those included police, military and others, and they were looking at all opportunities for all software and other ways of doing things. But you'd appreciate that even then there were challenges. But do you want to add anything?
Yeah, so yes, we're continually looking for better ways and more efficient ways of doing things, and the software system for the contact tracers was upgraded some months ago, and we continue to work through how we can use more efficient software in that process. We're also looking for how we can use technology, as mentioned earlier, to make sure that people are aware of their information that they need to know when they test positive, but also to provide us back with information about their exposure. So that's an ongoing process where we're continually looking at the quality of that and how we can make things more efficient.
One of the other things, Courtney, that's complicated is that the people who are doing the actual testing, the pathology groups, are obviously New South Wales pathology, but also a whole host of different private laboratories. And one or two of those have had some really challenging aspects in the last few weeks. And they were unable to get the numbers through that we needed to get through fast. They tell us that they were actually identifying the positives and getting those messages out to the positive cases, but some people were still waiting for their results for a number of days. They were going to be negative, but the administrative side just wasn't working as well as it should in those private laboratories. And again, that's something which my colleague down, in other states who have been challenged, other health ministers, Labor health ministers tell me it's been common in the heights of various challenge times in their states as well.
Can I just ask then, Dr. McAnulty, can you take on notice what is the actual time period? And if you have an end point, if you say after a week we can't get in contact with them or we haven't ascertained where it's from, then we give up and move on. Do you have a time period for that?
It's not as simple as black and white. We, as the Minister said, we'll go back to cases until we get until we're clear whether or not we can get the useful information, and then we need to move on. There's not a week or 2 week cutoff to do that. As I said, we do update the information we have about cases on our epidemiologic report.
Very much depends too, Courtney, on the person or people you're dealing with and what their possible exposure was to other people as to whether or not those judgments are made, but they're professional judgments that obviously the epidemiologists who work here make those decisions on.
Alan Finkel's report into the Victorian contact tracing regime recommends the use of advanced data analytics software to manage outbreaks. So it's true that New South Wales is no longer using spreadsheets for contact tracing?
Dr. Finkel actually came up here with a number of other Victorians and looked to see how we were doing it. So I then went back and gave that report after that because at the time Victoria was in a very challenged and sad situation. And in fact, I think it was probably the room I'm in now. No, actually one just next door. We did a whole day's seminar for him and for the team from Victoria so they could see what was considered to be the exemplar of processes at the time. But obviously, it evolves and our health teams are learning more and more and they are still getting updates and doing things differently. And as the pressures come on, there are still better ways to do it. So they're constantly reviewing those sort of situations.
Okay, but Dr. McAnulty, there's no spreadsheets that are being used now?
Oh, we use a range of different tools based on what's the best for the particular issue. So we primarily use a purpose-built database for our cases and contacts for NSIMs. We use various trackers and software for our contact tracing team where they're specifically having incoming and outgoing calls to track that information. If we need to use a spreadsheet to calculate various issues, we'll do that. So we use what is the best fit for the problem at hand, and we continually look to see if we can improve. We have teams of IT specialists helping us and teams of epidemiologists looking at what the best fit for the purpose is.
I'll pass to my colleague.
Thank you, Courtney. Walt Secord speaking for the benefit of Hansard. Minister, are you aware of reports this morning that vaccination records have gone missing from the Sydney Olympic Park, RPA Vaccination Centre, Sydney Airport Vaccination Centre, and Canterbury Hospital Vaccination Centre?
No.
Are any of the health officials there aware of this?
Does anybody know anything about it?
No. Sorry.
We take it on notice then?
Certainly.
Thank you. Okay. Minister, how does removing...
Can I just say, if it's vaccination details, Mostly they're, in any case, entered into a software system that then gets uplifted to AIR, which is the federal system. So I don't quite know whether you're talking about paper copies or what you're talking about. We'll find out, because if there's something that's occurred on that front, well, obviously, yeah, we need to know about it, but we don't know. None of us know anything about it.
Thank you. Minister, when it comes to removing and adding areas to areas of restrictions, how is that determined?
There's an entire process that goes on, Mr. Secord, that involves every bit of advice that Dr. Chant and or her team give. And normally what would happen is that she would be raising issues with her own health team. And there are many, many people involved in the health team, not just the epidemiologists, but also, as I said before, the others who might be involved, for example, in mental health or in the operational side. So, for example, if you're going to put an area into, for want of a better term, a lockdown arrangement, that has consequences. And the consequences could be, for example, what's the expectation that it would increase the desire for testing? What would it do in terms of vaccinations? Do we have capacity in that particular area to address those issues? Do we have support from the federal government? Are there police available? What's the impact on education? So each and every one of those issues are sorted through in a very collaborative way. And the decisions then are finally made by the crisis cabinet on the basis of all of that advice.
So that leads me to community concerns in Wollongong. So Shell Harbour has been taken out of the Greater Sydney area, and the Central Coast, Wollongong has fewer cases than the Central Coast. So there's community concern about why Wollongong was left in the restrictions area.
But as I said, it's not as simple as just saying there's a couple of cases, and Dr. Chan has answered that question probably 20 times publicly. And I'll leave that to Dr. Chan when she's next available to talk about those issues. But it's done on the basis of all of that collaborative approach that I just talked about. And it's very much a health-based issue, obviously, because it's a health crisis.
I'd like to take the opportunity. I noticed that Ms. Wark is here from Health Infrastructure. And I was wondering if I could ask a question about Rouse Hill Hospital, since this is budget estimates as well as taking information on COVID. I want to know, what is the status? Is Rouse Hill Hospital on track?
Dr. Ms. Walk is the person who does the construction and of what have you. And I think it would be difficult for her to give you any detail on that. So could I take that one on notice?
Well, I would expect that she would, in fact, have that information readily at hand, since she is Health Infrastructure.
But there are sensitive contractual aspects that we need to actually take on notice.
Well, I'm not asking about sensitive contractual arrangements. I'm asking about information that is the community would like to know in the city's northwest. For example, what does low-risk birthing mean at this publicly available documents, wanting to know about the progress of the hospital? For example, it says the hospital will have low-risk birthing. What does that mean?
That's not something for the health infrastructure person. She builds hospitals. That's a matter for the health team, and I'm afraid nobody here who will advise those sort of issues would be raised today, so we need to actually take that on notice.
Okay, when you're taking that on notice, could you also take on notice questions about the emergency department? The publicly available documents show that it'll be only taking level 4 and 5 patients. Maybe Dr. McAnulty could explain what level 4 and 5 triage cases or patients are?
No, we'll take that on notice too, please, Mr. Secord.
So, in fact, if you're taking it on notice, I would like to know what the level of the emergency department will be.
notice.
And if you're also taking it on notice, I would also like to know the number of surgery beds that'll be in the hospital.
On notice.
And I'd also like to know, what does health infrastructure mean when it says that it'll be, quote, a digital hospital with non-tertiary services?
On notice.
Thank you. And if you're taking something else on notice, I would like to know, for future expansion of the hospital, how would that occur? Because the documents show that the only expansion of the hospital could be vertical.
Again, on notice.
Okay, and Mr. Chair, I'll take the opportunity, if my colleague Courtney Hussos is ready, to resume questioning.
I understand we have the head of Hunter New England Health online. Is that correct?
That's correct, Courtney. It's Mr. D'Orenzo, Michael D'Orenzo.
Excellent. Can I just ask then a quick question about the clinical services plan for the Mid-North Coast and see where that's up to?
Certainly can, Mr. D'Orenzo.
Just ask the question again, Courtney, please.
So I'm just interested to know, what's the status of the clinical services plan for the North Coast, specifically for the Manning Great Lakes area? Sorry, we can't hear you, Mr. D'Orenzo.
Oh, sorry, it's been breaking up a bit, so I didn't actually hear some of the questions. So, sorry, could you just repeat that?
So if you could just give me an update on what's the current status of the clinical services plan for Manning Great Lakes, and when do you intend on releasing that to the public?
Yes, the current status of the clinical services plan is that it's been completed. It's been endorsed and supported by New South Wales Health. Sorry, can you still hear me?
Yes.
Sorry, I'm just getting some feedback, so I apologise. So yeah, as I was saying, it's been completed. It's been endorsed by New South Wales Health, and I've had the opportunity to present the clinical service plan findings and recommendations to a community group and also to the staff. And the next steps now really are about completing the master plan for the site and looking at how we prioritise the recommendations from the clinical services plan into our capital investment of $100 million.
And so will that clinical services plan be released to the public? Apologies, Chair.
Sorry, our process, sorry, Chair.
Go on, sorry.
Sorry, I was just saying our process to date is that we won't be releasing the document as it's an internal document that we've utilised to actually address the priorities in our construction and commissioning of the additional $100 million investment at the hospital.
The Honourable Emma Hurst.
Thank you.
Chair.
Thank you, Chair. I've got a question about the wait times that people are experiencing at some of the mass vaccination hubs, and maybe this has already sort of been covered when we talked about the staff from Westmead vaccination hub going over to Kudos. But I understand some people have been waiting up to 6 hours to get vaccinated, commonly up to 2 hours. Is that why the staff has moved over, and are we expecting those wait times now to change now that there's more staffing?
Emma, I think it's fair to say that I know literally probably a couple of hundred people have been through the mass vaccination hubs, and I've not heard anybody say that. What they say is it's an enormously efficient system. I know people have been in and out in 20 minutes. But what sometimes happens is that if you've got walk-ins, people who walk in and come in when they're expecting to just arrive and get it, well, they shouldn't do that. They should actually make an appointment in accordance with what has been publicly stated. But does anybody else have any updates on that? Again, I'm sorry, Emma, that question...
Just to clarify, the example of 6 hours was somebody that I know that did have a long-standing appointment, and I've had a few people talk about waits of 2 hours.
Where was it, Emma? Which one?
Kudos State Arena.
Look, I'm sorry, I can't answer that. I don't believe that would have been the case, but maybe it was in there because it's only been open for a week and a bit, and there might have been one day or something where there was an issue. But Susan Pearce, who was here before 11 o'clock, could have answered that question off the top of her head. I can't answer it other than to say, by far the bulk of people going through the mass vaccination hubs get the most amazing experience, and I want to thank again the staff at those centres. As you said, they're kind, they're caring, and they're very supportive. So, but I'll ask Susan, if you give me privately the details of what you're talking about, I will get that information for you and find out whether there was a particular issue at that particular time.
Thank you. And just to clarify, this wasn't in any way an attack on the staff that are working there. In fact, the people that talked to me about how long their waits were, they said that the people there were really extremely helpful and very friendly. So this wasn't a complaint on the people working there. But I guess what my question was, was that being caused by staff shortages, or were there other problems that were causing those delays? But I'll put that on notice.
I understand you're trying to ask the question sensitively and carefully. I can't answer it, and nobody else sitting at the table can, because Susan has left.
That's all right. I'll put it on notice. Thank you, Minister.
Well, you can give it to me privately if you've got details of the patient. I'll chase it up.
Okay, I will do. Mr. Minns, you wrote a letter to New South Wales private hospitals last week, if I'm correct, that non-emergency surgeries would be cancelled from August 23rd. Have the same rules been put in place in public hospitals, and how long do you anticipate that this ban will stay in place?
Phil Minns speaking. I signed the variation under the licence agreements for private hospitals, and I think one of my colleagues actually wrote to the operators. So it's important to understand that it doesn't apply to emergency surgery, and it doesn't apply to surgery that we think could lead to patient deterioration that would have consequence over a 30-day period. So now most of the hospitals within the New South Wales system have been turning off their elective surgery for several weeks, and it's happened as the category, not all categories. Yes, actually category 2, category minor categories. It's been happening according to the level of COVID present in their operational footprint. So we went there first as a system, and then as the kind of demands on our workforce have been ratcheting up, it wasn't led by me, it was led by a colleague, but we've had dialogues for probably 2 weeks with the private operators before reaching that position where we made variations last week. And I think, the point to make is that in a workforce sense, this year we've got, as you all know, more cases of COVID in our facilities than we ever had last year. And we're also rolling out at scale this enormous vaccination effort. So the measures were taken in a sort of consolidated decision by the New South Wales Health Executive, because we just think that we're at the point where workforce requirement from the private system is going to be critical for us in the coming weeks.
So you expect that there'll be more hospitalisations of people affected, and so that's why there's been that shift. Is that what you mean by that last statement?
Emma, what he's talking about is the fact that last year the federal government established, with all states and territories, it would have been about June, I guess, the fact that as we were increasing in numbers across the country, and therefore you're wanting to make sure that you've got availability of space in the public hospitals, we established that although we were advised to shut down certain categories, there's basically 3 categories of surgery, elective surgery, category 1, category 2, category 3. And category 3 is the sort of stuff that, or the sort of surgery that normally takes up to about a year. It's not urgent. The urgent surgery absolutely gets done. Category 1 absolutely gets done. Category 2, it depends on the particular circumstances of the particular patient. And the idea is simply to free up space in the hospitals in the event that you did have progressive increasing numbers. It's just a matter of what we've talked about a number of times, making sure there's adequate use of resources. The private hospitals were then engaged by the federal government and the state governments. We all effectively shared the cost. They paid money, we paid money. And so at the time, you might remember, the other thing that was happening was that the state hospital, the private hospitals were effectively shutting down as well, just simply because people didn't want to go in there because they were worried they might get COVID. So there are a whole lot of factors that came together. And in the end, in order to keep the private hospitals operational last year, there was an amount guaranteed by the federal government, and then we paid for services that might be needed in those hospitals. Similar things have been put in place now, just in case we do need them. There's not an immediate urgency, I don't think, on that, but it's certainly what's happening just to make sure that we have effective and capable resources and staffing to back in what we need if there were a challenging time. At the moment, the system is operating under pressure, but still operating well.
Thank you. Do we have any kind of, I mean, I know that, like, I suppose I'll change my question. Is it sort of a wait and see how we go before we open up to that, back up to elective surgery? Or do we have some kind of basic timeline that we're hoping to work towards?
I think the basic timeline is as soon as possible, but that really goes to the questions we were talking about before, or the commentary before, that there's no absolute clarity. But if the vaccination rates continue, and I encourage each of the members of parliament to encourage their constituents to get vaccinated, if we get vaccinated, and if we can just get people to stop moving around in those areas where there's heavy viral load, life's going to look pretty damn good by about October, November.
And Mr. Minns, Mr. Minns, do we have the actual percentages recorded or tracked somewhere as to how many New South Wales healthcare workers have been vaccinated?
We do, and I could provide them.
Yes, please. Do you have them to hand, or is that on notice? Sorry.
Henry's looking on his computer, so I think that.
Okay, thank you. I couldn't tell.
Okay, so this is data for today. If we talk about the metropolitan local health districts, 89% have received the first vaccine. And if we talk about the average for the regional and rural system, 70% have achieved the first vaccine. If we talk about the entire health workforce with all of its agencies and associated entities, we're at 76% first vaccine.
Thank you. Are we confident that all New South Wales health workers, would be vaccinated by the 30th of September?
We're doing all in our power to encourage them to do that, and the Minister has mentioned his intention with respect to a public health order. That I think will create more compelling reasons for our staff to consider and get vaccination. We'll also be running information campaigns to ensure that people with concerns about vaccination are provided with the best quality advice.
That latter comment, while we had a big meeting last week with all of the private hospitals and a lot of the public health sector. There were, I think, 2 unions present, one union wasn't. And but we've since had discussions with another union as well. And I think the point that Mr. Minns was just making about education was raised by the unions as being perhaps a more helpful approach. And so we're keen to be as collaborative and as encouraging as possible. So we're keen to get that done at the same time and somehow weld that into our actions over the next few weeks.
Thank you.
Deputy Chair, can I just check to see if Mr. David Shoebridge is there?
No, it's me this time, Craig.
Thank you, Kate. Sorry, back to you, Kate.
Yeah, no worries. Thank you. Just in relation to ICU beds available in the state, I just wanted to confirm that the state has, I think, 844 staffed ICU beds available and 608 of them are currently occupied. Is that correct? I'm not too sure who I'm directing that question to, but it would be great for someone.
Advice, Kate.
Gotcha. Right.
The advice, Kate, that I've had in the past, not in the last few weeks, but was that we surged up last year to ensure that we have 2,000 ventilators, and that determines what might be available in the event of any major needs. But I understand that Dr. Nee Nguyen was talking today at a press conference about some of those issues. So I think we'll have to update you by getting some of those figures later. But I think the point Dr. Nee Nguyen from that press conference was highlighting, I didn't hear all of it, but I heard a little bit of it, is just the fact that there's a lot of staff working and with the qualifications to do the job. But we're obviously hopeful that we won't get anywhere near the capacity that we currently have. But I'll get you the details.
Sure, just in terms of the modelling though, like it's a critical thing, of course. I'm sure New South Wales Health has done it in terms of what the modelling is saying. What could happen in terms of, for example, a doubling of case numbers within, say, a fortnight, which is very possible. So what does that mean for the state's ICU capacity, particularly the ability for the staff to be, like at those ICU beds, of course, adequately trained ICU staff? Do we have them?
As I said, Kate, we'll take it on notice, because I say to you, the modelling has to be also taken carefully. Last year, when I sat in meetings in March and April, the modelling was we would have 25,000 deaths by the end of last year. We actually had just over 50 people, which is for each one of those families was terrible. Each one of those people was terrible. And again, I express my sympathies to those families, because I couldn't think of anything worse than having a close loved one pass away in any situation. But the pandemic anyway. I think the issue then is that if the modelling can be so far out, I think we need to just look at how we're going in terms of the structure at the moment. There's been no concerns raised with me at this point that our ICU capacity is in risk or at any major challenge at the moment. But we'll see what we've got, and if there is something I can give you, then I'll happily give it to you.
Can I just check then, just in terms of the 2,000 ICU beds that the government has stated is available if needed? We also know, of course, that I see that COVID patients spend a lot longer in ICU, roughly, I think the average is 10 days compared to other patients. So if we end up having to use all of those beds, those 2,000 beds, which the government has said is there, do we have adequately trained ICU staff to staff those beds? I thought Mr. Minns, maybe as Director of People, Culture and Governance, would know whether we have those adequately trained ICU staff.
Yes.
With respect, yeah, sorry.
So Phil Minns speaking. Look, last year we conducted a range of surge activities to strengthen and bolster the ICU workforce. And we did refresher courses for people who had worked there previously and hadn't been working there of late. We put, for example, about 350 to 400 nurses through that refresher program. So now they were not required in the context of last year's experience of the pandemic. We've asked all of the LHDs through the chief execs and the workforce directors to refocus on that surge planning that they did last year. And so, I know that that's in train. The significant extra pressure that's on us this year is the work that's going on with vaccination. So it's important to note that wherever we can, the vaccination workforce we use is not drawing from the supply pool for places like ICU. So we've set up, the Chief Health Officer has signed authorities to enable quite an extensive list of clinical workforce to engage in actual vaccination. And they have to do that having done the appropriate training under the authorisation. They have to be supervised if they're in a particular category. If they're a student, for example, they have to be in line of sight of an immunising nurse or a registered nurse. And that has produced quite a surge in the VAX clinical workforce that is not drawing from your ICU pool.
Okay, thanks, Ms. Mizzo. Just wanted to move to a question then, just to ensure that if we did have to use those 2,000 beds, which some people are suggesting potentially, given that I think the government has said that we could have a couple of thousand or several thousand more cases, and of course a doubling of the cases that are here now in terms of exponential growth, right? So say we have a couple of thousand, we need those 2,000 beds, ICU beds. Is there enough PPE in New South Wales, particularly obviously in terms of airborne emissions? So is there adequate PPE in New South Wales if we have to use all of those beds?
Okay, last year in February, March and April, it's fair to say that even I was taking calls from health staff who were worried about whether or not there would be available PPE. The crisis cabinet led by the Premier embarked on what was the most amazing effort to try and get more PPE. We never got a clear line of sight from our colleagues, the federal government, as to what was in the national stockpile or how that would be allocated. So we made a decision in New South Wales that we were going to get separate supply lines for ourselves of PPE for our own staff. It was challenging because all of these masks that you see us wearing now, that people tend to be wearing, were actually being made in Wuhan, which was obviously a problem. But over the ensuing months, we went all out to try and get sources. We made arrangements with some Australian manufacturers to get some made. It covers all sorts of things like the gowns, the masks.
Thank you, Minister. Sorry, I am going to interrupt there. Like, the question specifically was, can you guarantee that there is adequate PPE, particularly airborne PPE, if we have to use those 2,000 ICU beds? I don't need an explanation of all the different PPE that you ordered a year ago. Can you guarantee that there's adequate PPE? Because I'm hearing from health experts that there isn't.
Well, your health experts are wrong. As I was about to say, and by the time you finished, I could have actually finished what I was saying. So we went all out to try and get supplies. And we have, instead of one warehouse with PPE, the last time I was advised, I think we have 10 warehouses, Madam Secretary, is that right?
Yes, we've got 131,000 pallets of PPE in the whole of government warehouse and over 5 million respirator masks, 109 million surgical masks. We have an ample supply.
We have more than an ample supply. We have squillions of supply. So I don't know where you got that from, but it's wrong.
So can I just ask then, if you have so much of it, which is excellent to hear, why then is airborne PPE not standard for all healthcare staff in New South Wales right now?
Look, as you said before, I mean, the reason why we're wearing masks is because it is airborne. We know it's airborne. And I know you thought it wasn't necessarily advertised, but it has been quite strongly. And the appropriate PPE in appropriate circumstances and with appropriate risk is addressed. And I'm quite satisfied that occurs across our entire health system. But obviously there are varying... Sorry, just let me finish, Kate. There are varying degrees of risk in various settings, and the various hospital administrations make sure their staff are well covered. Do you want to add anything, Madam Secretary?
No, it was Dr. Lyons in the morning session that outlined the risk rating and the advice.
Yes.
We have an expert panel that is on the settings, and we use that expert advice to provide in direction to the health system.
Thank you, Ms. Koff. Given the outbreaks in hospitals, though, that have occurred over the last couple of months, is that not an indication that not enough staff are wearing airborne PPE at all times? Why are these outbreaks occurring? I understand they're occurring in staff that aren't wearing airborne PPE gear.
Look, I think you come across the secretary, but she said that an expert panel that advises on what staff should be appropriately wearing, but also during the course of last year, we made the point that no PPE is absolutely guaranteed not to, or it's not going to necessarily stop transmission. Transmission can occur for a variety of reasons. You literally only need to put your fingers near your mask. It doesn't, and you can get the virus moved around. The mask might not be fitted properly. The mask might be moved. You might take the mask off because it's irritating you. There's a whole host of factors that come in this case, and all we can really say to you is we have ample supplies. The experts give the advice, and that's what's followed in the entire health system.
I understand the Honourable Walt Secord has one final question.
Yes, it's in relation to Tenterfield Hospital. I think that is Mr. Di Lorenzo still here? Yes. You would be aware that in late June, the Labour member for Lismore, Janelle Saffin, wrote to the minister and to the local health district calling for an independent external investigation into the management of Tenterfield District Hospital, including concerns of staff and also concerning that there was no on-site doctor at the hospital. What has been the response from the government and from the local health district to those concerns?
I can answer that. I had the opportunity to sit down with the local member for Tenterfield and went through a process, and the agreed process was that we wouldn't do an independent review. It was not necessary. The issues came from two complaints from two patients who had unfortunately an experience that could have been provided better to them. There were no clinical issues of any significance. And so what we did instead is we did a review based on the fact that we sent in two of our very much leading rural clinicians. So we asked our Director of Nursing at Tamworth-based hospital, and we asked our Director of Emergency Services at Armidale Rural Referral Hospital to go to Tenterfield and be there for the week and undertake a review with a report back to the Chief Executive and to the board on what their findings were. The review was looking at those complaints in more detail, but really assessing the role delineation of the hospital, its ability to provide the role that it plays up at Tenterfield, and also to do exit interviews and to interview a lot of the staff around some of the issues that have been raised at Tenterfield for quite a while. That report has been completed. It's in draft mode. The COVID situation has delayed a little bit of that at the moment. It will come back to myself, and we will discuss that with the board in due process and basically put in some of those recommendations to improve what needs to be improved at Tenterfield Hospital. I've got to say that nothing of any significance has come out. The issue about doctors, we looked at that again, and we only had a doctor that wasn't there, I think, one occasion over the last 4 years. So a lot of this is about putting some evidence on the table about the ability of the hospital and how we work together with the community. So that's where the whole process is up to, and I'll be sharing that with the local member.
I've got it.
Okay.
The Honourable Secord can't have a follow-up because we have now gone well over. So further questions can, of course, be placed on notice. That brings our budget estimates hearing for portfolio committee number 2, health, to a conclusion. Minister, can I thank you and the government officers, all of them, for coming along and participating today. Can I ask you, Minister, would you please pass on our sincere thanks to everybody, literally, who works in New South Wales Health, who are doing such a great job, along with the New South Wales Police Force, emergency services, and members of the ADF, who are doing their very best to protect all the citizens of New South Wales from the COVID-19 pandemic. Thank you very much.
And can I just say thank you to the committee for their interest in what the health system is doing, and also for not only yours, but also the other comments that have come from members thanking the entire health system and the health team, because I do think we have the most amazing people working at front line and working, for that matter, in the back rooms as well. And I want to thank you for acknowledging that, and also the others, the police, the ADF, the emergency services. We are effectively still in a war zone, and we are all working very hard. So thank you very much for acknowledging that.
Thank you, Minister. And can I invite committee members to stay online, please, for a short deliberative? But that brings to a conclusion our public hearing today. Thank you.
Oh.